Thank you. Appreciate it. So, welcome to Module 8, Coaching for Resilience, Well-Being, and Burnout Prevention. And this is going to be a big part of the coaching experience because this is the topic du jour, right? You've probably already experienced this. Go ahead and advance to the next slide, if you will. We're going to take a look today at a variety of things related to well-being, coaching around the subjects of resilience and burnout. And I guarantee you will all have this experience, and if you haven't already. So, as far as how we're doing, let's look at accessing materials, some of the micro learning. How are things going? Any difficulties? Nobody having any difficulties? Good. We just like to check in with that to make sure. Coaching circles. How are your coaching circles going? Tell me what's good.
I think just the practice has been awesome.
Okay, you're getting some good practice. Excellent. All right, Frank, go ahead.
I agree with Leah that's been really valuable.
Yeah, excellent. Well, I know your coaches have been speaking highly of the work that you guys have been doing. So, yeah, well done. That's great. Pro bono coaching. Any wins or challenges related to that? Elizabeth, what you got?
Yeah, I think the coaching's been going well. Love the highs of seeing the light bulbs come on. I've also had a challenge with one of the clients that has, it almost feels like they're kind of resisting just the idea of coaching, canceling, coming late, and really even during the session, not engaging in the work the same way that I see others. And so that's been something that I've been working with Pauline on individually in our one-on-ones, but it's so much so that I actually grabbed another client because I'm afraid this particular client's gonna fade out on me. And so that's just caused a lot of question in my mind as to why is this not valuable to the individual. I think we all do a little bit of self-evaluation from it, but I'd say that's been the biggest challenge for me in the coaching.
Yeah. And it's so good to run into that early because you're gonna see that people who are not ready for whatever reason, and that's a great opportunity to find out if you're in the right conversation. So sometimes the right conversation is not the one that they really want to have. So that happens. It happens. It's very rewarding when you win them over, and there's not a perfect score in that one. So yeah. All right. Any others? Go ahead, Mo, please.
I just have an announcement, but also comment on Elizabeth. That's just always remember it's not you. Because the tendency would be, I must be doing something that they're not responding. And just we have to remember sometimes it is the coachee not ready for being coachable. And you did your part. So, and that's sometimes the tendency is we would just, it's like, well, it must be something I'm doing that they're not responding to that. So just gonna reminder it's, and maybe at a certain point along this program, we'll talk about when it's time to fire your customer and your client.
Yeah, thank you for that, Mo. And I did, they even asked me, because they know we shared up front that we're students, and they even asked me, are you okay with time? Like I said, well, I don't want you to worry about me. I'm fine. in my coaching time, but I need, I want to make sure for you this has value. And so it's interesting. They weren't ready to kind of cut ties yet, but
Mhm.
I agree with you. That's something probably over the next couple of months that I need to see if some of those conversations need to be had. But thank you.
Yeah. And there's power in the final conversation, because sometimes people will need the tough conversation that it's going to say, look, we're not the right match and you're not ready. And sometimes they just need that. Then people will wake up. It's like, oh my God, um, so we can kind of, at certain point, I'm sure Pauline is working with you on that. The other thing I would love to announce is that the next cohort is September, end of September 2024 for the next academy. And so we would love for you to recommend other people that you think will benefit from this. If you believe that this was been a great experience for you. So, but any recommendation that we can form the next cohort, we have people from other organizations that they're interested. And so, but would love to get the recommendation from you if you know of other people that could use on that. The one change is that we're going to make it a full day where the learning circle will be part of the day. So then that way you're just going through the whole day, you're blocking a day instead of trying to find multiple places of time. And that's based on feedback we got, that if we can just kind of have deeper time for application and stuff like that. So please, if you know anybody, just let us know. We'd love to have them in the next cohort. And that's the announcement of the day. Oh, can I have one more?
Of course.
Remember when you guys did, all of you coached me on, health and well-being, and you remember that we did the train?
Yeah.
Okay, well, I'm happy to report that it worked, and I have consistently since then worked out every day, and I lost 10 pounds. So
Nicely.
your coaching work.
That is beautiful. Now each of you send him your bill. It's absolutely worth it. What's the value of that, Mo? That's fantastic. That is great. And it shows the power of coaching, because he took that seriously and considered it and took action. Well done. Nicely done. All right. So as we move forward, again, to wrap that last slide up, if there's anything else that we can do for you regarding connections, etc., questions, clarifications, you can always reach out to us. All right. Next slide, please. So here's where we are. We're in that all-important middle space, and it's really about the facilitating growth and development, the assessment and goal setting, co-creating the action plan, and the conversations. All right, we've talked about questions and inquiry, and you'll continue to practice that, listening and exploring insights. And so as we get into that, we're going to be focusing on some specific competencies with both the ICF and the WABC. The competencies, the ICF competencies, are demonstrating an ethical practice, referring clients to a better qualified professional when appropriate. I'd highlight that, because sometimes when we're looking at things like burnout, as you'll learn today, sometimes there are broader implications. There are deeper issues, and it may be outside your scope as a coach to deal with those. How you address the handoff or the partnership or whatever it turns into is as important as the coaching itself, because a person that's in that vulnerable state, they still need you, and they need what you can provide by way of a soft, compassionate, handoff. And I use soft in quotation marks because sometimes those handoffs require some forthright diplomacy and some important, deep, not so soft conversation, but always with compassion. Embodying the coaching mindset, which is a good segue to that. Choosing to continue ongoing learning and development, learning for yourself, learning through other people's experiences, being self-aware and reflecting as you hear people talking about things like burnout and wellness and that, and reflecting, how does this mirror my own experience? And recognizing that that's both a benefit and a place where we can get hooked, particularly if we're in that space. Self-awareness and reflection and willingness to seek outside help when necessary, again, as we talked about before. With WABC, knowing yourself, self-insight and understanding, know where you're at in relation to the other person, know when your self-talk is helpful and when it could potentially be getting in the way. And then self-mastery, managing your thoughts, feelings, and behavior, right? Because as you reflect on this, you hear them reflecting their experience, there's things that are going to possibly impact you emotionally. They're going to impact your physical and energetic being as you are present with them. Maintaining some self-control under those adverse and stressful situations, and maintaining your demeanor, composure, and temperament. It's about being centered. It's about when something comes at you in a coaching situation, and we'll tell you as coaches that you will step on a minefield. You'll walk into a minefield and you will step on a landmine, something so emotionally powerful that you did not see it coming, and drawing on all of your training to recenter, to breathe, and to be in that space and recognize what you're there for in that moment is extremely important. So this is part of the coaching world, is we're delving in places of vulnerability, and people have allowed us into this sacred space. And sometimes there are some scary things that hide in that sacred space. And yet if they come out, recognize that that says something about the importance of our relationship, the person. And it also points back to that that awareness of when we may be out of our depth, or maybe a partnership or a referral may be appropriate. So a lot of things that go on in there, not to scare you, just to say this is an acknowledgement of an important space that you will find yourself in at some point. Managing your own behavior to prevent and reduce feelings of stress. So there's something about that too, is how we approach it as coaches says something about how we come away. You work with numerous clients a day. You may work with, as a professional coach, half a dozen people a day, or if you work with groups, even more than that. And taking on that energy, taking on their challenges, etc., without having some healthy way to move that out of your body, to move that into a grounded space where it needs to be, can be challenging. And it can result in some physical things manifesting with yourself that maybe you didn't expect. So just be aware of that. Those are some pieces, and we'll move your thinking forward and support you as we talk about these kind of things. Next slide.
Thank you so much, Dan. It's really clear that what you just went over drives the design of today's session, with 3 parts that focus on that self-discovery. We will bring up identifying boundaries, of where the boundaries of coaching are and when to refer. And then role modeling by seeking outside help as needed. So that's in the 3rd part. Coaching has an outcome of well-being and resilience in a good scenario, and these competencies really speak to the responsibilities that you have as a coach. So thank you for walking us through that. Anyone who has started to do any research or reading on well-being, on burnout, will recognize that this has been an exploding field of research, with more and more studies, more and more models, and offerings to help. I have been extraordinarily selective in picking content for today's session, because I don't want to make you an expert in well-being and or burnout. I want to really hone in on that relationship between coaching and well-being and or burnout. So what you will find in this session are three main parts: the self-discovery of your personal well-being and how to potentially enhance that. We will then switch perspectives to how to coach a client who is dealing with burnout or for whom well-being is one of the desired goals, and how to move the needle on that. And then last but not least, coaching clients for leadership, which includes the responsibility for the well-being of the people that they lead. And then you will have the pleasure to watch Dan and Mo in demonstrating 2 case studies that we have put together. And obviously then there will be enough time for all of you to practice some coaching as well. So let's start with the first component of understanding what well-being, stress, self-care, and energy management really means. And I want to start out with really diving right into a debrief of the pre-work, where we invited you to journal about what well-being actually looks like to you, what it means to you, what it looks like to you. And I would love for a few folks to share what they have come up with. You can also use the chat, and my partners in crime here have promised they will looking at the chat and help me monitor that. But ideally, anyone who would like to share what has come up for you as you reflected on and journaled on the meaning of well-being for you.
So if I could just share, through this journey, I've found that, of course, I defer activity and self-care, as I'm sure everyone around the table does. But I found that I've got a great deal of pleasure out of seeing how I can better care for and support folks around me. And it's a little different than just a transactional service model. It's something that, to me, I've come to conclude that it actually is sort of part of my being. So part of my commitment to personal well-being, I know I need to spend more time on doing some of the things that Mo has achieved recently. But I also need to reflect on the things that I already do enjoy, and that's been very helpful, because it's explained a little bit why I've made some of the trade-offs, and not always the right balance, but sometimes good choices on why I didn't spend as much time on myself, and that makes me feel a little bit better in rebalancing.
Yeah, thank you for sharing that. You spoke really eloquently about discovering purpose as a key point of well-being for you, before also mentioning choices, boundaries, and I see that's popping up for Leah as well. Good boundaries, the being present in the moment. Thank you, Danny and Leah, for sharing. Who else would like to go and talk a little bit about some of the aspects that came up for you?
Hey, Dirta, it's Frank. I'll weigh in. I reflected that I really like a challenge, whether that challenge is overcome or whether I fail at overcoming that challenge. The process of being challenged connects me to that. Maybe it's the flow state. I hadn't used that term, but and that gives me a sense of well-being and maybe purpose a little bit too. So that was an interesting insight for me, and also thinking through it. maybe I don't have enough self-reflection to know that this is true or not, but it felt like as I was processing this that the achievement of overcoming the challenge wasn't as important as the challenge itself.
Yeah.
That might be a blind spot. I need to explore that more, but that was my thought.
I think that's really, really interesting because that's not as commonplace of a comment that the challenge itself is part of a well-being experience. You will see this in the first expert definition that I'm going to share in just a second. That is surprising for some who see that. So thank you for sharing that insight with us, that the challenge itself is part of this. A few other voices.
This is Josh. I was doing this exercise at the end of not quite 2 weeks in Europe on vacation with my family. And so it was a unique, I flew to France the day after our last session and then came back this last Wednesday. And the epiphany I had is, man, do I get my batteries recharged when I take a big chunk of time off like that. I came back and went right into being on call at the hospital this weekend, and my sort of feelings about working at the hospital over this last weekend were really impacted by having just come back from vacation. It just didn't feel like that big of a deal to get back to work. And I've known that about myself, but I think it was interesting to do this exercise right after coming back from vacation and really palpably feeling how recharged I felt. And of course, we just had an incredible trip, and my kids had a blast, and we saw all the art and ate a lot of food, and it was incredible. And so anyway, that was the epiphany I had, was just like how foundational, and that was what led to some of the worst of my burnout during the first part of the pandemic, was not getting to take any big vacations. We tried to do a little stuff here and there, but it just didn't have the same impact that the big vacations have for me.
Yeah, that's beautiful. And it really speaks to what we're going to cover as well, the energy management, refueling at many, many different levels, and good balance between work and personal life, and how that leads to improve work or ease of work performance, and joy in the personal time. So thank you for sharing that. Yeah, I agree with Mo. Recovery is so very important. And I think that's been missing for many people during the pandemic. What they usually do for recharging and refueling was really greatly limited. Thank you so much for sharing that. For some reason, I cannot add. Okay, so here is one of the two expert definitions I want to share to make the point of how multifaceted it is. And Frank, what you see here, what I've highlighted, being challenged, is an interesting inclusion in a well-being definition for many who see this for the first time. Thriving and achieving the success, and pointing out that this has to happen in both areas, in the personal and the professional life. A second one, and I should say a little bit something to Shanafelt. Ted Shanafelt is really the thought leader and really first very serious researcher in this field. He comes from Stanford, has the WellMD program there, and is really recognized as one of the experts in the area. And I've known him, or I know him personally from some work with him, and it did not surprise me to see that being challenged and thriving and achieving success is the very first part for his definition. That is very much what he embodies. I want to contrast that with a definition from two female researchers, both from the University of Calgary. Jane B. Lemaire is a clinical professor and the head of a well-being or wellness department, and Jean Wallace is a sociologist. And you find really quite a different flavor of well-being here, with its focus on meaning and self-expression, authentically self-expressing and then a focus on overall satisfaction and balance. So quite different, and together with the definitions or the aspects that you have mentioned, I think we're starting to get a sense how incredibly individual and multifaceted the concept of well-being is. So it comes as no surprise that when you Google well-being models, there are many, 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 and you can see they're all multifaceted. So they are looking at lots of different components. And just in time for Pride Month, they come in very cheery rainbow colors. So just a little point to make here that the models reflect this multifaceted and highly individualized aspect of well-being. There's one model that I want to highlight, not so much going into depth here and working through this, but to suggest that to you as potential further reading, if this topic is something that interests you in particular. This is from Martin Seligman, who is an incredibly famous psychologist who's done regular psychology as a therapist for many years, focusing on what's broken, and then really changed the trajectory of psychology by switching focus on what is actually working well and founding what we now refer to as positive psychology. And he is someone who actually really dislikes the term happy because he thinks of it as a very flat and shallow concept. And he instead kind of has introduced this model of well-being that consists or captures these 5 key concepts, of which we have heard in all of the individual comments you made. There is the accomplishment for the A, the engagement we spoke about earlier. That is basically flow, what he describes. Meaning, Danny spoke about purpose, recognizing his raison d'etre and why he exists, coupled with positive emotions and positive relationships. He is introducing this model. I have put a reference here. We have a very brief kind of summary of his work, Flourish, for anyone that we can send out as a link. And anyone who would like to dive a little bit deeper into this topic, I highly recommend this book. It's a model that stands out to me because of its quality, because of its solidly evidence-based research that surrounds it. And it is incredibly practical, not just for self-care, but also for guiding your thinking in helping when you coach someone who's burned out to see what might work well here as an action step. So it's highly evidence-based and it is highly practical. And I think a good model for any coach to know about. So we're coming to the next debrief of the pre-work. We asked that you reflect on kind of how people around you know when you are stressed and how you know that you are stressed. So I would love for some of you to share what you have written down or what came to mind when you read this prompt in the pre-work. And I know I'm stressing out Wes with these very long silent pauses, but I want to leave plenty of time. Go ahead, Leah.
Yeah, actually, it took me a moment. Oh, sorry, Leah. Let me just speak over you.
Oh, Michaela.
It actually took me a moment to really, I really had to think about it. Like and then for me personally, I think it's more of a feeling, and sometimes it takes me a little while for myself to recognize it. And then I know, okay, I have been stressed. It's interesting that I think as I'm ramping up into stress, I'm actually blind to it. Unless it's something very obvious, like here, there are 5 patients you should admit and somebody else is crashing on the floor. And that's an obvious, but that's, so I was really curious about why that was, and if others were experiencing that as well, because that way I think it also takes longer for me to be fully aware of how I show up when I'm stressed.
That is such an excellent observation. And I want to offer a couple of thoughts before reopening the floor. One is, and Mo always points that out, that stress is not necessarily a bad thing. We all know the Yerkes-Dodson curve, where stress and performance really go up together and have quite an important function for high performance. Once you tip over and the stress becomes prolonged or too intense or severe in intensity, performance suffers, and that's when the stress responses become more evident. So why that is, I want to put that in as a plug that we will probably pick up later again. But I think medical school, being socialized as a physician, has a lot to do with that, because you are being systematically trained to turn off all the signs and symptoms that you experience yourself. You're focusing on someone else, and you have learned to ignore, to recognize hunger, sleep deprivation, needing to go to the bathroom, feeling stressed, sad, etc. That is a little bit driven out of you when you go through medical school, because it is highly functional, not worrying about these things while you're trying to go through medical school. So I think it's part of how medical school is structured and how you're socialized. But some other thoughts or other explanation to Michaela's really important observation and question.
Tom might point out that there's some really good observations in the chat box also about withdrawing or isolating or eating or
Yeah.
noticing the physical changes. It's always fascinating with how unique it is and how we always have opportunity to discover more about ourselves in that regard.
There's great variation already in behavioral, in cognitive, and emotional responses. Leah, you were about to say something as well. I may put you on the spot.
Sure. No, I was just gonna talk about what I put in the chat. It's really evident to me now because it got a lot worse when I had kids, but I get really short-tempered and irritable, like really quick to sort of snap. And then Dan put the breathing change, and I do that too. I hold my breath. And then that manifests in like that feeling of anxiety, because my body's like, you need to breathe. I didn't realize I'd stopped breathing. So it's the breath and the tension that comes with that mixed with irritability for me. Pretty evident, actually, now that I'm aware of it.
Yeah.
Definitely for me too, it manifests more at home than at work. Like it's like my kids, they can hold it together at school, and then the meltdowns come when they get home, and they can only keep together for so long. And it's the same for me. I'm more irritable with my family than I am at work.
Yeah.
Yeah, same.
One thing I didn't put in the chat, but that I noticed more, is I also start telling myself more stories. And when I start telling myself a lot of stories, it's like, wait a minute. I must be the problem.
Say more about that. That is so deep and so fascinating.
I think that, and I see this probably, well, no, I would say maybe I see it at home more, or maybe I see it at work more than at home, but just situations that are not personal, I can really start telling myself a personal story about it, and hopefully catch myself. But I'm not 100% on catching myself.
Yeah, beautiful, beautiful. The impact on cognition, on the ability to not take things personal, to feel a little paranoid, to feel a little bit unable to step back and to change perspective. That's a really important piece for coaching, actually. So what we see, I guess I need to close this first.
And I'll just add to that aspect of storytelling. And this is why under stress, we see a lot of bad decision happens.
Mhm.
It's because our minds start playing tricks on us of either justifying our behavior or not being able to even process rational choices. And we're just going to go with just exiting for the sake of exiting.
Yeah.
And you know, it's that aspect of, can I notice first that do I have that I am in a space where I can make some rational decisions, or no, right? And I think in medicine, it's kind of like that's part of the residency, is like we stress you out so much that you're going to see if you're going to be able to. But then now we're starting to recorrect that and say, maybe that's not the way to keep someone awake 24 hours a day and then expect them that they're really going to make rational decisions, clinical decision into that conversation. And so being able to kind of think through that, and I just wanted to kind of build on Elizabeth aspects of, it's the mind not being in full capacity to be able to process all of this.
That is such an important comment, and I can share that I have 2 clients right now who approached me and wanted to work on basically decision making, where they wanted to take their career next, into leadership, out of medicine, etc. And something told me they are not in a good place. So I really scanned for well-being, burnout, or stress, and both of them really are severely burned out. And as a coach, I said, I am not going to work with you on making a decision about your career until you are in a place where you make these decisions for the right reasons, where you're going towards something instead of just leaving behind something that you have identified now as a stressor. And that is something where coaching and knowing stress symptoms, burnout symptoms, is important, so that you can kind of protect your clients from themselves at times.
I mean,
So we
Dan,
have, go ahead.
I'm sorry, just Dan and I get the call usually of, we want you to work with this physician or this person because they're disruptive.
Yeah.
And that's typically how we get the call. And Dan, you can confirm this, but like majority of those conversations ends up being about burnout.
Yeah.
And their behavior is manifesting itself into
Yeah.
people labeling that as being, oh, they're just misbehaving, you guys need to fix them, versus
Yeah.
they're burned out and they just need help.
Yep. No, it's a really good point, and speaks to the strong connection between stress and behavior, isolation, withdrawal, just as much as trouble making, aggression, short-tempered. Some additional cognitive impacts of stress include memory, the clarity of thinking, and inability to concentrate. So additional impairments. And then a really broad variety of feelings or emotions, anything from being overwhelmed to guilt, not being able to keep up, anger, depression, anxiety, fear, depersonalization. We will find that as one key element of burnout. So we're dancing around here between stress and burnout, and these contexts can be quite confusing. I think in one of the next slides, there will come much better clarity what the difference is between stress as a more transient situational feeling and burnout as a consequence of prolonged stress that is not being coped with in an adaptive kind of way. So just setting some foundation here with these complicated concepts. So we are on to our next debrief. A fascinating article in the HBR that offered a lot of really interesting kind of techniques and tricks on what to do to refuel, to manage one's energy. But before we go there, when you took the assessment, what did you learn about yourself? And was there anything that surprised you?
I was pretty good everywhere except for mind. That surprised me, that I could be good in 3 of 4 and have some, checking all the boxes for one of the 4, but doing pretty good everywhere else. That was insight.
And why did that surprise you?
When I first looked at the audit, I thought, oh, I'm doing really good. My own self-assessment was, oh, I'm in a good spot, and indeed I am in a good spot almost everywhere. So that was it was just surprising to have one category that was out of balance. I had thought, if one part's out of balance, it's all going to be a little bit off, and I'm not going to be focusing in the right areas in any of those spots. So that was a surprise to me.
That is really interesting, to not have it kind of across the various aspects of energy drains, but having it really focused in the area that's here referred to as mind. And I'm wondering if your particular job has something to do with that. Not having uninterrupted time to think, being very much in a reacting mode, that comes with leadership, that comes with being in healthcare and putting out fires and being interrupted constantly. So I see that a lot in my physician clients. Other comments? Let's see what's in the chat. Yeah.
One of the things I run into, Dorte, is a recognition as I went through this of my reliance on other people to help monitor. Because when I get really motivated and it's like, wow, my calendar is packed and I'm helping so many people, I don't see the burn. I don't, I mean, I may feel, that positive physical exhaustion that you feel after a great day of coaching you've done. And it's like, wow, that felt really great. And yet I don't recognize that, oh, gee, I went right into the next task and I'm not rejuvenating myself. A good example of I've got, family members who know that I need a little bit of help when I'm getting to that place of being a little more short-tempered, a little less tolerant. And they just, hey, maybe you need to take a break. And I've got my assistant, Jack, who literally, I should show you my calendar, because she literally will block out whole afternoons in gray. And if an afternoon is blocked out in gray, she says, you're not working, because she knows I've been working too hard, and she'll impose a no work period. And I can tell, because the more gray shows up on my calendar, the more I've been burning it too hard. And I need to reflect on that. I need to stop, slow down, and think about, how do I maintain my balance and well-being? Yeah,
very nice. That assistant is precious.
Very.
Rihanna, I saw in the chat, one of the surprises, if you're willing to share a little bit more, but that you were surprised about the spiritual energy component being somewhat on the lower end of your attention.
Yeah. I scored, 4 out of 4. But it was just something that I think I missed and I wasn't considering, right? And I think, the body and mind and the emotions, are pretty easy to consider, but I just have that bigger spirit component. So it was a nice reminder to refocus a little bit more energy there.
Yeah, like Mo said, this assessment is a really good reminder that there's so much more to us than the work, than the body, than emotions, that there is the spiritual part, there is the emotional part. I see that Leah said that emotions is a little bit more of a challenge for her. Any other commentary? Any other voices? Anyone else who would like to share?
So
All
if I
right.
could share, oh, sorry, is someone speaking?
Go ahead, Danny. No, go ahead.
If I could share, I think I found also surprised that some of these areas look better than I would have thought. But then when I looked at the score at risk for burnout, I still scored high enough to fall in a risk category. So it just made me think, okay, maybe these tools are imperfect, but then maybe, you know, this is not something that is a snapshot. You really got to work at it because there's still risk implicit in the work and just the nature of maybe how I operate.
Yeah, thank you for sharing that, Danny. I wonder if that's what I heard you speak to is a little bit habituation to a fairly high level of stress, being surprised that it is actually what you consider a normal level, that's still considered by others potentially as high risk. Very, very nice share. Thank you. Leah, you are unmuted. Anything else you want to share?
I was just reflecting on sometimes with things like this, there's such a good insight. And also I can find myself saying, well, I should be better in any given category. So like for me, I said emotions was the lowest. And part of me thinks like, well, I should make time for things that, you know, I deeply enjoy, and I should be more present with my family. And it almost makes it worse. So trying to come around like messaging for myself, and then also acknowledge that for me right now, this is a season where my kids are really small and I don't necessarily have any extra flexibility in my schedule to do some of these things. So it's almost like acceptance and like shedding the should and sort of the emotional baggage and burnout that the should puts on us, right? To be better in any given category and to be able to sort of shake it and say, this is not going to be forever. I'm not going to globalize or catastrophize this. It is what it is for now. I don't know if any of that made sense, but I'm sort of reflecting on that to be.
I think it is
Yeah, like, let it go.
absolutely beautiful. Something I find myself in many coaching sessions highlighting to my clients how much their thought process is driven by should not, should do better, and how hard these expectations we put on ourselves are in sync with what is really happening or what is really possible at that moment. And this is almost like an Eastern philosophical aspect of acceptance and Zen that I find in very few of the models. There is this, yeah, be present, but that it comes with this expectation of having to be present at all times, again, becomes an unrealistic expectation. I find it sometimes funny when I see people, you know, being so focused on the sleep quality numbers that they get on their watches and stressing out over that, and not being able to fall asleep. That I think is a really clear illustration of what you were just talking about. Thank you so much, Leah.
Yeah, it's interesting, Leah, that you bring this up, and this whole aspect of should and stories we tell ourselves, but also what social media is actually adding more to it, because everybody shows up on social media as if like the world is perfect and everybody is enjoying themselves, and then then we can sit in hours like, oh my God, you know, what am I doing that it's not they're able to do that? And I see that in my work right now in Bhutan, which as a country was the #1 happiness on the happiness index and is no longer. and
Mhm,
they traced it back to the introduction of social media.
mhm.
Now all the younger kids believe that the grass is greener in Australia, and everybody wants to leave to go to Australia. And because they redefined what happiness is,
Mhm.
as like you should have whatever you should have what other
Yeah,
people have, versus
yeah,
look at what you have and how great it is relative to what. And so it's so interesting these days that all of this energy is also being sapped by all the imagery that we get
yeah,
stimulated with every day. And not just us as adults, but the younger generation of redefining what should be versus what ought to be. And that's just fueling more stress and burnout and mental issues and all those things just because of that. And grace is the way to do it. Just give ourselves
yeah.
grace. It's,
Yeah,
it,
it's a very important comment, Mo. Thank you for sharing that. And as a personal share in therapy many, many, many years ago, I realized that I'm vulnerable to comparing my experience to that of others, and have recently found a saying of comparison is the root of all suffering. Comparison with others, comparison what should be, the comparison of what my ideal life looks like. And again, being interested in Buddhist philosophy, the not even expecting that what we have is great, but accepting it for what it is, and making a very conscious decision to not engage in social media whatsoever, which is a difficult thing to do when you're trying to build a business. But that's just as a side. Really good conversation. Any other comments before we move on? Let's move on to self-care. Here are the 4 areas that were highlighted in the energy audit, and that examples were brought in the HBR article. Any one activity or tip or technique that was described that resonated in particular with you, or something you are thinking about trying out or implementing?
I'm thinking of trying that sleep thing. That sounds kind of fascinating.
The sleep thing? Say more.
I
Like
see a
getting
lot of
some.
smiles. Yeah, this whole group knows what I'm talking about.
I see.
Yeah, it's, I mean, we fool ourselves into believing that, we can go on, X number of hours, as a small, and yet, we know there's research. It was interesting. The Army Sleep Study Center, first off, the fact that the United States Army would have a sleep study center, it says an awful lot itself, doesn't it?
Yeah.
But they recognize that the typical human being, which, okay, physicians, while you think you're not in that category, clinically have demonstrated that you are, require 6 hours of uninterrupted sleep in order to not experience serotonin drawdowns and things like that. And there may be, greater experts on this call than I, but that I get what they're saying. And there's the 6 hours of uninterrupted. And this is one, forgive the military analogy, but this is one of the reasons that they fire those stupid guns all night long when you're in a conflict. And they're putting rounds down range constantly, and it's entirely to interrupt sleep patterns. It's not to hit anything. It's just the sad reality, though, is that those of us on the backside of the guns are also getting our sleep cycles interrupted. So,
Yeah.
the importance to the human body of getting enough sleep, and saying, well, 5 hours is fine. I can operate on 5 hours. Well, some people somehow seem to. However, I've discovered, and you all may see this as well, is not nearly as many as claim we can do it. I think we're kind of fooling ourselves to an extent. I certainly am. If I don't get 7, I start drawing down, and I have to recognize that because I don't always get that.
can share a brief anecdote. When I started med school, I was intentionally getting 5 hours of sleep a night. I thought I performed at my best at 5 hours, and if I got more than that, I was worse. And of course, within the first couple of months, we had a section on sleep and the importance of sleep, and so I was swayed by the data, and I started sleeping 7, and the difference was remarkable. And somewhere along the way, I had just become convinced that, man, I feel way less tired if I sleep 5 hours. And I think there is a thing I've noticed in myself that a lot of times when I get more sleep, I will wake up feeling sort of groggier, and I think it's the lack of stress hormones. Like, I wake up without stress hormones and I feel more groggy, honestly. And it takes a little bit more to get going, but I think over the course of that day, I'm way better off. And sometimes when I get, interrupted sleep or less sleep, I wake up feeling kind of energized or almost hypomanic. But that's actually just stress hormones, and it's not really productive in the long run. It's not ideal. And Leah, I'll tie this back to what you were saying. It's just something we don't talk enough about having kids, and how it is just your schedule is not your own, particularly when they're super young. Your sleep is interrupted. It's a very difficult period for everybody who lives in the house of a small child.
Yeah. Very important points. Oops. Go ahead. Anyone else?
During COVID, I started to set an alarm to go to bed because there's always more work and other stuff to go. And I took that from a friend who basically, had her alarm go off at a party, and when we were gathering, like, it was like a barbecue, and she's kind of like, okay, I'm heading out now. I'm kind of like, well, what, do you have something tomorrow? Something early? She's like, oh no, this is just me prioritizing, sleep. Like, we all wake up with an alarm, but we don't go to bed with an alarm. And really gave me food for thought, and I'm trying to really stick to that. That's sort of to have then that sort of wind down routine and really help with that. So yeah, I have a bedtime alarm.
Yeah, it's fantastic. So the illustration of how intentional we have to be about refueling, that it doesn't come natural and it doesn't get necessarily rewarded by society either. It's awkward having an early bedtime. I can attest to that. And it is often our culture a badge of honor to needing a lot of sleep or not getting to sleep, of multitasking constantly, of being overworked. If you're not overworked, you must be in a low demanding job or not being ambitious enough. So there's a lot that we have to push against by setting intentions on how to take care of important aspects from this self-care menu, so to speak. I want to switch gears unless there are any burning questions, and I think I'm somewhat on time. Wanting to switch perspective from the self-discovery of, how is my stress? How does well-being, what does it mean to me? How does stress show up for me? How do I refuel? To focusing on having a client who may be burned out or has as a goal well-being improvement. So I want to take you fairly quickly through quite a bit of stuff that I think is just common whenever you hear someone talk about burnout or well-being. I just want you to know some of these key concepts, and then focusing on what does that mean for you as a coach? What can you take from this material to apply in your coaching practice? So, something odd with my slide. I want to start out by showing you the World Health Organization burnout definition and go through this in really 3 steps. The first one is to clarify this overlap between stress and burnout. It is not the same. Burnout is considered a result of stress, and not just any stress, but chronic stress, prolonged stress, or highly intense prolonged stress. And again, even more defined as stress that happens at the workplace. So we're not talking war, we are not talking climate, we're talking about the workplace as a context for burnout as a syndrome. So a kind of a bunch of symptoms together from chronic workplace stress that has not been successfully managed. Again, going back to the fact that stress is necessary for high performance to a certain point before the curve really dips into something rather dysfunctional. Next, this is kind of the 3 symptom kind of mix that is really at the core of burnout. This is based on research that Maslow has done, and that's been adopted by the key definitions of burnout. Is first a feeling of emotional exhaustion. Second, this sense of depersonalization. So having a mental distance from one's job, feeling very negative or cynical related to one's job. I always find when my clients start to talk to me that they are angry at their patients, that is typically a really good sign that they are dealing with depersonalization, because they certainly did not go into medicine and on a good day they are not angry at their patients. But once that anger sets in, we do need to explore the existence of other burnout symptoms. And the third one is reduced professional efficacy. So it takes you much, much longer to do the same things. You may make more mistakes. So Josh, that might be a little bit what you experienced, that the sleep deprivation kind of that made you thought you're still performing well, noticing the difference when you're fully fueled and at your best is quite remarkable. And then the last component is, again, an emphasis on burnout as a term, being linked specifically to an occupational context. So not at home, not in other scenarios, but really in the context of the work environment. The ICD-11 does recognize the syndrome of burnout, but it is not classified as a mental health condition. It is not considered a disease or a medical condition, which is kind of important when we think back at the ICF competencies and practicing within your boundaries of coaching and not tapping into treating medical conditions like clinical depression or other things. So it's kind of important to really keep these 3 aspects of what is burnout present. The word is used very ubiquitously. Everyone says they are burned out, or you come, from an annoying meeting and you may hear someone say, "Oh, he burns me out." No such thing, right? It is really a pretty serious and complex syndrome that we are dealing with here. What it is not simple stress. Prolonged stress that's not coped with in an adaptive way can lead to burnout, but stress per se is not burnout. It is also different from clinical depression. It shows several symptoms that are alike, that could make you mistake one for the other. But this is actually an area where lots of studies have been conducted that show that working on work environment improvements eases and helps recovery from burnout, not from depression. So these are 2 distinct pieces. Fatigue, being tired after a really stressful day, again, is not something that makes the threshold to burnout. You can recover from a fatigue. But when we are talking about deep physical and mental fatigue, you're getting closer to the concept of burnout. And again, it is not a mental health condition, which is important for us as non-medical or non-clinical coaches. Couple of stats. The prevalence right now is at 53%, which is actually a slight downtick from its high in 21, which is kind of shocking that 53% is a little bit lower than it was at its worst. This is a number by the AMA, American Medical Association Burnout Benchmark. The newest data that I had access to was from 2022 and 23. And they're using basically the scale that I'm showing you down here and the distribution of currently the burnout prevalence in the United States among clinicians. And as you can see here in the color coding is kind of the same as it was in your pre-work assignment to identify which of these descriptors fits your situation the best, and only the bottom three, I'm in serious trouble, I need help, to symptoms won't go away and I'm really worried about, I'm starting to burn out and I may need help. Only those three are considered people being burned out. Experiencing no symptoms or some symptoms, primarily in the arena of stress, is not considered burnout. So a sliding scale here. This is a ubiquitous slide. If you ever hear someone talk about the consequences of burnout, this is kind of the slide everyone shares. And it is really split into two arenas. One is personal consequences and one is professional consequences. And the way I want you to look at this for this particular purpose of talking about this topic in your coach training is the professional side of it gives you basically data for making a business case why an organization should invest in coaching, why it should invest in well-being programs and putting programs in place that reduce burnout, because it impacts the quality of care. It impacts and increases medical errors. It impacts a subjective patient satisfaction, not necessarily the outcome of their treatment, but how they feel about it. Productivity goes down, professional efforts that could be contributing to, positive things in an organization are not there anymore. There is no additional kind of time spending. Physician turnover is the easiest to quantify. It's also obviously not a linear causal relationship. People do move, they get married and move somewhere else. So not all physician turnover is based on burnout, but there are pretty accepted formulas at this point that if you know your average turnover numbers for a year and you know your average burnout rates, you can calculate, assuming that onboarding a new physician or APP or nurse costs a certain amount, you can put a dollar figure. So again, the professional side of burnout consequences, important for anyone who cares about quality, safety, productivity, and financial success. Left-hand side, the consequences of severe burnout on the personal side, I want you to look at as basically describing the boundaries of your ability to reach people with burnout. Suicidal ideation is not something that you can cure with coaching, nor can you cure clinical depression that might be a result of severe burnout, nor substance misuse or broken relationships. These topics come up in coaching sessions with clients who experience burnout. And it is kind of the job of us as coaches to identify how far along are we with these? Is this something that I, with ethical standards can still accept as something we want to tackle through coaching? Or is this really beyond my reach, and requires a soft conversation, a compassionate conversation, or a tough one? So this is kind of the core reasons why I show you this slide in combination now with the different severities of burnout. When you've established that someone is at this level, you're definitely prompted to seek additional or pull in additional resources that you need to offer this client. And those resources, and I've just put 3 rather large buckets here, include an employee assistance program, so something through your work that it offers free sessions with clinical psychologists or psychotherapists. Then having a couple of well-trusted, highly qualified mental health professionals in your community that you can use to make that suggestion that someone seeks them out, and your local crisis management, so the suicide hotline. In my last organization, I did a little bit a roadshow on physician suicide, and the numbers are really staggering. We lose about 1 physician each day to suicide in this country. Talking a little bit about the symptoms and how you can help. And I made everyone take out their phone and plug in the number for their local crisis management. The number has become easier. It has become unified across the United States and is 988, if I remember correctly. So 1-800-988 will get you automatically to your local crisis management. And I'm making a pretty important plug here, or passionate plug here, to have these resources and materials in place before you're sitting across from a physician that worries you, that brings up really serious conditions, and you're worried about their safety or the safety of others. So this is the time to get these resources ready. You don't want to scramble for that when you need to have that tough conversation with a client. I want to stop for a second and see if Mo or Dan or Wes have any additional comments. At this point, I also want to address the elephant in the room. Pauline and Lori are not here. They are at a conference. They are unfortunately missing today's sessions, but they're sending their hellos. So this is why they're not on today's call. But Mo, Dan, or Wes, any commentary, anything you feel differently about or find important about this this pitch I'm making here about the boundaries of coaching?
Yeah, it's there's a couple things that I think are pretty important. One was a great quote from and Mo may remember who the guest speaker was. It was at a conference in Orlando where this individual, he wrote a book about his experience as a patient. He was severely injured in a car accident, and he said they approached him and offered him counseling. He's like, I don't want that, because counseling is for crazy people. And then he realized that the truth as he went through this journey, that our counselors for crazy people? No, they're for smart people who want to stop hurting. And I thought that was one of the most poignant ways of of wording it that I've ever heard, because a lot of times you get where it's seen there's a lot of stigma around that kind of a referral.
Yeah.
And so helping your client to recognize that this is a case where a smart person can stop hurting, I think is particularly powerful for physicians and other healthcare professionals who are you know, they've been given this label of being heroic, and
Mhm.
reality is they are yes, they're acting in heroic ways, and yet they're still as vulnerable to these type of things. One other thing I'll mention is that knowing your local mental health professionals, like for instance, in Washington State, we have the Washington Physician Health Program, WPHP. Knowing those folks, I've got them on speed dial.
Mhm.
I've got them right here. So if I run into a situation that is outside of my scope, and yet is clearly a mental health situation with the healthcare, particularly physicians and advanced practice clinicians, others, I can contact them right away, and I can make sure that there is a warm transfer so that the
Mhm.
person isn't left hanging.
Mhm.
I don't want to leave them, in others. I
Yeah.
don't want to let go of their hand, as it were, until I've made sure that that's connected to a supportive resource and that they really are held and cared for. And the WPHP folks are great with that. So, so know who your people are.
Yeah, and a lot of states have kind of pre-screened and participating psychotherapists on their state medical association group webpage. A lot of them have programs for physicians and offer basically free access for a certain number of sessions to known psychotherapists who work a lot with physicians, so know the implications a little bit of dealing with the fear of renewal of license, if I have to disclose that I'm seeking mental health counseling, etc. So they're sensitive to that. Mo and Wes, any comment, any clarification or correction you feel is necessary?
I think you stated it really clearly. I don't have anything to add, but thank you.
I think the work, the rest of the discussions that you're going to have is going to be really meaningful. So I think we're good here.
Perfect. Great. Any questions from all of you? We will be talking, like Mo mentioned, about the narrative of help-seeking behavior. We'll talk about the power of role modeling help-seeking behavior later on. But any other questions before we move on? All right, let's go to causes of burnout. And there are many. Like you've come to expect at this point, everything we touch in this arena is really multifaceted and rather complicated. There are acknowledged work factors that impact burnout. If you ask any provider, they will tell you that burnout for them started when the EHR was implemented. Epic or Cerner, whatever beast you are working with, that is not necessarily kind of proven by evidence, but it is definitely one of those really annoying, time-sucking processes in medicine, or has become in medicine, that contributes to a not so great work experience. Workload, the number of hours, number of patients, the focus on productivity, pajama time, all of these things, risk of malpractice lawsuits contribute to work factors that can cause burnout. Then there's personal characteristics, and that's obviously where we will spend a lot of time, since that is where coaching really has the most impact. And a couple of examples to personal characteristics that have been identified as causing or increasing the risk for burnout are things like perfectionism, idealism, lack of self-care, lack of sleep, sleep deprivation, being not particularly prioritizing one's own self-care. And then last but not least, organizational factors, including things like staffing or the quality of leadership. the culture of an organization that either values or doesn't value healthy self-care and healthy ways of coping with stress, and perpetuate a narrative of stigma around this are certainly important factors. Insufficient recognition, rewards, staffing again as a model for that organization contribute to burnout. So this is one of the most well-known well-being or burnout response models by Dr. Tate Shanafelt. Again, we saw his definition. Anyone in the field of wellness or burnout is familiar with this model that is very similar to these three aspects we just went through as causes for burnout: the work, the personality, and the organizational. Here, it is called culture of wellness. So the work environment, behaviors that promote self-care, professional growth, compassion, etc. Leadership that role models that. Efficiency of practice, those are really the hardcore workplace systems, structures, processes that we deal with that are meant to promote safety and quality, that impact how effective and positive patient experience can be. And they structure a lot of, is there community between providers, or is this a work environment and a practice environment in which isolation is really a big deal? And then last but not least, personal resilience. We just talked about that: individual skills, behaviors, attitudes that contribute to physical, emotional, and professional well-being. As you can see, they're avoiding kind of the center of this model being about well-being or wellness. Instead, it highlights professional fulfillment. Again, helping with centering this work on the work environment and taking it out of all these other arenas of wellness models and work that can become a little bit fuzzy. All of these three elements influence each other, and there's a very strong sense that a lot of wellness programs up to now have focused on increasing personal resilience, which has not been well received, because studies have shown that folks going into medical school show an above average level of resilience compared to, you know, the general US population. So physicians have an above average ability to bounce back from stressful situations. So focusing wellness efforts on making you more resilient really feels like, and is often perceived as, oh, you're just trying to help me cope better in an abusive system. And rightfully so. So at an organizational level, as an internal coach, as a chief wellness officer for an organization, I took care that we really focused heavily on culture of wellness and efficiency of practice, and offered, as needed or as desired, programs that strengthen personal resilience, just so that we are not telling a burned out physician to just meditate their way out of burnout, which is really a rather insulting kind of statement. The dilemma with coaching and well-being comes that this is the area area we can influence, because that's what we control. That's where mental models, that's where storytelling, that's where, you know, stigma around self-care is either helpful or not helpful. But I wanted to make sure that all of you are aware of a more comprehensive model being needed for organizations to really promote a well work environment. But our focus as coaches is in this particular area. Any questions and comments? I know I'm going to
And-
turn it over to Mo next for an excursion. But I wanted to really show side by side the causation of burnout from work environment, personal characteristics, and organizational to the model that really represents that causation in offering very practical programmatic things that can be done at the organizational level to reduce or recover from burnout.
Yeah. Yeah, this is, it's such an important element and a dynamic of that. And I think you kind of said something so important about that. You cannot breathe your way out of this. And we've been in this business for a long time. I've seen it all come and go. And typically it's like, oh, our clinician and our nurses are burning out. We need to help them. Well, let's just do a burnout program type of aspects. And it is all of these, and it is, but also as our role as a coach is to empower the client. Because when you look at these, and especially the red one, the tendency would be for us to say, well, control what you can control. Well, you can't control whether you are working in the culture of well-being, or you don't control what the practice is. So let's just focus on what you could do yourself. And I think it's not empowering. The empowering would be is what can we do, and what are the things that are in your practice that you can with that. And that's kind of the next few slides is that's what we took as an organization. We took the attitude of, well, go after the hassle factor, because clearly what's in your way and frustrating you is the discovery of what's a hassle in your way. And it could be a hassle of the way I deliver work or the way I do things, and empowering them to say, well, what is one thing that is in your way that you can go do something about it by engaging others in solving them, versus, well, there's nothing I could do. And that's the risk of when you have these equal division of it's the culture, or if it's the process, if it's the individual, that it's not an either or conversation. It's that we need to help our client identify all three areas that if they can't control, they can influence. And that's the leadership aspects of things.
Yeah.
Versus there's nothing I could do. No, there is tons of things that can do, and just it's a matter of the story, but also it's the enabling that. So the hassle factor index, as it was a creation of that, of saying, go find one thing that's frustrating you or frustrating your team, and then go do something about it.
Yeah, that's beautiful. And that's exactly why the third section that we have put in this program is coaching a leader who is responsible for the burnout, well-being, or cultural wellness in his or her area. And before, Mo, you go to the hassle factor index, Michaela, you had your hand up, and I want to make sure you can share what was on your mind.
Yeah, thank you. I thought maybe you'll get to that demo in that hassle factor discussion, because one of the things that I find difficult to balance is there's a certain level of busyness in our professions that unfortunately comes with the job, right? It has intensified for a lot of various reasons. And how do we strike the balance to acknowledge that, yes, it is busy, and right, I mean, some days it's just right, the traumas keep rolling in, how you know how that goes. And but not overly creating like victims in this whole process, when we are saying, oh, we're so busy, because there's this healthy level of busy, we often talk about it, and then when does it become unhealthy and unsafe? And
Yeah.
and there's a lot of learned behavior, I think, especially as leaders, that where we can either teach people, well, just suck it up, buttercup, at all times, right? Which is that leads to burnout, or we can create victims and people who are not necessarily, or we can probably diminish personal resilience in some way. So I'd love, and I'm sure you'll get to that, but how do we explore that, especially as we're coaching leaders to,
Mhm.
because it's messy, right? If it was easy, we wouldn't be talking about this probably.
Exactly. That's the thing. This is the reason to have a coach that is able to see and hold the situation and be able to see the totality of things versus in an impartial way.
Mhm.
Being able to bring the empathy, but also it's being able to balance, to call it out when people just kind of, you start using the victimization or the powerlessness. Oh, there's nothing I could do about this. Oh, it's them that they're doing this. Oh, it's, and our role as a coach is to be able to kind of go back to the you. It's like, yeah, I'll go down with you all the way down and really just understand the situations. But at certain point, we got to stop going downward spiral. And at certain point, you gotta kind of like, well, apparently this is serving you. And so we're gonna consumer it. And am I serving you by just kind of staying with you and this like downward
Mhm.
spiral of,
Mhm.
oh, there's nothing I could do. Oh, there's like, well, apparently this is serving you well, that you just love to be in this hopelessness and playing a victim. And me as a coach, I got to call it out at a certain point of,
Mhm.
don't tell me that, there's nothing that could be done. I mean, there's like, because there's things could be done is you can go get somewhere else a job. You can go, I mean, like this lack of, I gotta play the victim, and then all of a sudden everything is like, and then everybody's like, well, we're burned out. Well, we can't push them into
Mhm.
this. Is we were with a group last week, and we were having this aspect of, are we having adult conversation or are we having parenting conversation? And then our role as in the coaching, especially when you're coaching a leader, is the leader having parenting conversation with their nurses and physician and everything else, saying, no, that's okay. Well, versus are they having adult conversation of saying, okay, what's the hassle? What can we do about it? Or what are the things that is making it complex? What can we do about it? Versus, oh, I'll take it. I'll go fix it for you and come back. And it's like, are you creating dependence, or are you really empowering people to solve their issues on their own and build that resilience? And I'd love to kind of get thoughts and feedback on what I said. Then
Mo,
you deal with it daily.
so Mo, I find it a little difficult in the role of a coach when we have to address the area of organizational resilience. And yet there is so much you can individually do. I actually find it a little more easy to deal with as a leader in an organization
Mhm.
because it opens up, more dialogue. It's not just two folks talking about it. But I do think that this is the conversation, and also about making sure we're not going down some of the rabbit holes you described, Mo.
Yeah. But Danny, I think, and this is the value of a coach that has been in healthcare versus a coach that has not.
Mhm.
And you bring your experience into the conversation versus when somebody says, well, it's, like, okay, if I look at all the hassle that we collected over time, I would say 50% of them could do something about it. Okay, it's just a matter of quantifying them versus it's this big blob. There's nothing I could do about it. And then that's why we always kind of like always blame the EMR. Like the EMR is the like, well, it's yeah, it's one thing and it's that unmovable thing, but there's other things. And when you look at the list, I mean, there's things that are cultural, there are things that are process related. There are, I mean, if you blow this, just that, you know, like communication between the providers, the discharge, the consultant coming in on time. I mean, if I'm coaching someone and they say, and I did that a lot with hospitalists and with nurses, is that, okay, well, if your consultants are not showing up in time so that you can discharge in time, then what conversation are you having? Versus I play the victims like, well, they're not doing their part. Like, no, this is not a children conversation. This is an adult conversation. And you tell me when and what are you going to do about it type of conversation versus, oh, there's nothing I could do. Right. And that's this empowerment of, yes, there's 3 elements, but also it's, are you a leader? Are you a spectator of this? Or are you just gonna do something in that regard? So I can coach people into that, but I have to have the experience of knowing what really is real versus what really is just story that the customer's telling themselves. Other thoughts or Chris, you've done a lot of work in this space. What have you seen as when you're coaching people? And
well, I resonate with everything you said so far. I've hopefully seen the smiles on my face. Yeah, I mean, it's the research and the models. It all helps going into the discussion, but ultimately, it's a conversation, individual conversation, and that sort of funneling down. I'm trying to understand what they need personally to thrive and feel well, and then it's just using your model, basically just trying to figure out what the challenge is, what the roadblocks are, and keep whittling it down until you figure out what it is. And interestingly, what you end up with in a client often does confirm the research, but you never start with the research and say, well, this is what you needed to try, right? So I think just trust the coaching model and ask the right questions, and it'll confirm much of what we're hearing today.
Yeah.
Yeah, I really like how you put in perspective the use of the models that we have gone over. They are a good starting point to come up with questions that help you whittle it down.
Yeah.
They give you a really nuanced version of what you could check on to get a picture of where is this person and what could the needs be.
Yeah.
Yeah.
And actually, if you go to the reason when we created this, it's really one question, like what's in your way and how much does it impact your work? And then what can you do about it? Right. I mean, it's like, it's not a 50 question, it's one question. And it is all the conversation about trying to find out, and this is really more for if you're coaching a leader of, okay, well, you're worried about, are you concerned about your team being disengaged or burned out? I mean, those are the 2 things that always comes up. It's like, my team is disengaged, they're busy, I can't ask them for more, and they're also burning out. Like, okay, great. How do I go from being a philosophical conversation or conceptual conversation to being more concrete conversation? And the only way to move into concrete conversation is to document what is it that's the causes of that. Don't go say, oh, I need to help them become more resilient. Yes, needed, but not sufficient. Yes, needed, but not sufficient. You can help them with that, but also you can empower your team by saying, what is it that we really can work to that? So quantification is such a critical element of this. And and maybe some of you we were probably at a certain point in those type of conversation of that, when we don't go around collecting all the monkeys. Go around, go around and say, all right, what is one thing in your way and what can we do about it together versus give me your monkey because you're stressed and burnt out. I'm going to solve it for you. It's like, well, you end up with 100 monkey after you finish your rounding, and so it's the empowerment conversation over and over again for leaders is burnout is an issue. Yes. But every industry has the same thing. Every industry has stress. Everybody has complexity. Every industry, and everything is also relative. And so it's always a reminder of us as coaches. I get to listen to your things and listen to what you're saying and how you're saying it and you're feeling about it and empathize with you. But at the end of the day, I get to just hold it. And I got to start challenging your stories you're telling yourself. I can't tell you how many stories where, look, oh, the world is, it's like, there's nothing. I hate going to work. And I like, okay, yeah, and I can go down with them and like, listen, it's like, yeah, tell me how you feel. And why is it and how is that? But then it's like, then I got to stop and say, do you want to do something about it? Or do you want to just kind of like keep in that, stressful or in that, or are you going to do something about it? That's my 2 cents for today.
Thank you so much for sharing that. I think it's incredibly helpful in combination with this, control visual that's helpful to people who get stuck in that victim mentality, to show, yes, you can control this, but there's more that you can do. And that is you can influence aspects in your work environment, especially when you are in a leadership positions. Any other comments, observations, questions you have?
This, by the way, I mean, this circle, I also always, I don't think, well, actually there's one of them up there, is I always also do this with a 2x2 with my client. And I'll just say, okay, let's tell me all the things that are causing issues, right? And like, okay, so which one has high impact and which one we can control or will take less resources to be able to go after it. But let's find one that's high impact, that's causing you level of stress or frustration, that there's going to take less of your resources or depends on others. Let's just go after that. So the 2x2 is always like a great way of going from the world is there's nothing I can do to, no, there's things that you can just, people refer to them as low hanging fruit or like, and the reason for it is just, you're trying to build momentum and build confidence. Like, yes, you can do something. Yes, you take one thing and work on it. And you guys demonstrate that probably every day with, the way you lead or engage others.
And the conversation we're having now is really about coaching leaders, coaching leadership or self-leadership. And the topic can be burnout. The topic can be a gazillion other topics. The principles are the same. So when I prepared for this session and talked to Wes, he said there is going to be a module that focuses even further on leadership, and will pick up on what we're talking or what Mo is talking about right now and what we will cover in just a few slides. So with that in mind, I'm just highlighting one study here or just a excerpt from a famous study that Lotte Derby did at the Mayo Clinic, that started to give us really numbers and evidence that coaching can help with burnout. in showing that just 3.5 hours of professional coaching over 5 months reduced overall symptoms of burnout, as well as improved the overall quality of life and resilience. So some key factors. The slide I show here on the right is really, I think, speaking to that empowerment aspect that Mo was talking about by highlighting what are the topics, the themes that come up when you do burnout coaching. It's addressing workload, leadership skills, integrating personal and professional life, engaging in self-care, hobbies, community building, all of these things. So this is a good study to have in your back pocket when talking potentially to decision makers about, well, can coaching really move the needle on burnout and or leadership? So another pre-work that you did, self-evaluation, that's a little bit an odd assessment that I wanted to include before Wes will go over, another one that's probably a little bit more easy to digest, and that's self-compassion. In this self-valuation, I like to at least show that or have you go through it, because it is so very much healthcare specific. And it is a good tool for almost kind of like risk assessment ahead of time. And it focuses on the level of someone prioritizing personal well-being and a growth mindset in the face of a mistake or a challenge. It is, again, very healthcare provider specific, but I think it is very translatable into coaching questions that can help with that action planning and getting out of that cycle. So how do we talk about, no, not how do we talk. This is not about the narrative yet. This is, answering those 4 questions that pertain to, habits and thought patterns or stories we are telling ourselves. When you took this assessment, what stood out to you? What surprised you or what resonated in particular? Oops, sorry. Going the wrong way.
I think just like Frank said on one of the other assessments, I had really I was always or never.
Interesting. How do you interpret that?
Well, I think maybe over time I've just been more attentive to things. Like I'm pretty good at making sure I get my hikes in and my health side of it. But I think the self-talk around the condemnation if I make mistakes or less compassionate with myself, I think those are my areas of great opportunity.
Yeah. Great. Thanks for sharing. Other experiences or thoughts you had with this? If there's not, Chris, you unmuted yourself, so I don't want to cut you short, but.
Oh, yeah. Good observation. I was mouthing what I was going to say.
Just think out loud.
Yeah, that's what I should do. Well, no, I should not do that. I felt that the first question, the self-condemnation, was a little strong for me. I really feel those extreme sort of emotions. So it was a clear never for me. But maybe if the question was worded a little bit different, I might have answered it. So I don't really condemn myself or anyone, but more like, yeah, I can be hard on myself sometimes. But would I go as far as self-condemnation? Probably not.
Okay. Yep. Yeah, certainly not perfect tools. No.
Yeah, no, I mean, it's and I think Leah just said the same thing, is that it's the compassion with ourselves. You know, somebody said something one time, is like, you know, if my brain was a friend, I would have ditched them long time ago.
Yeah.
You know, it's like what we tell ourselves, or you know, or how tough we are on ourselves and don't exercise compassion. I mean, if we're taking that and made that a person, we wouldn't hang around that person.
Yeah.
And that's kind of it's not just, it comes down to, if we dig into what burns people out, what people causes them to feel imposter syndromes, what
Mm-hmm.
comes down to how much self-valuation and how much self-compassion we exercise. And it kind of like, and so again, go down to, I listen to what people are talking about in the situations and in the feeling and so on. And then this is where this stuff down now kind of you dig below the surface and you start getting into this stuff, and you start immediately feeling there's a lack of valuation and compassion and confidence, because we're just trying too hard to show ourselves to be something that it's not, and it would just evolve into that. And so just, I'm glad that you included this into the assessment, because it just opens up a whole
Yeah.
conversation with your coachee on that, just talk about some of that.
Yeah. And that's exactly the reason. It's this uncovering what's the narrative, what's the inner voice that someone uses, why something is possible or not possible. It gets underneath any potential challenges of self-empowerment. And again, would you ever speak to someone you care about the way you speak to yourself? So that's exactly the reason. I think I'm a little bit behind, but I am turning it over to Wes, who can probably make up a little bit of time, because you all deserve a little bit of a break. We are 2 hours in. Wes, do you want to take it from here?
My suggestion might be, if we're talking about self-compassion, maybe we should go ahead and take that break, and then we can hit this really quickly when we return.
I think that sounds great. So we are
top of the hour.
yes.
We typically schedule about 15 minutes for this middle
Yep,
break.
perfect. So we meet again at 10:15 your time.
You know, I was joking about taking a nap on the break, Dan, but this information from the Stanford survey about the primary determinants of burnout were low self-compassion and self-related impairment,
Mhm.
sleep-related impairment. I think self-compassion is the reason that we're not sleeping well. Instead of having it a separate issue, I think it's grounded personally. I think it's all in self-compassion. And Director, let's go ahead and skip this slide on what it is self-compassion. This group probably has a handful of a pretty good handle on what that is. And honestly, after working with this material on self-compassion with groups and with individuals pretty consistently over the last 5 years, I personally think it's not, or that the real issue is denial. And so I have found the biggest challenge for us, whether you're coaching or presenting, is how do you get through that level of denial that, yeah, I have plenty of self-compassion. I'm a very compassionate person. I work in healthcare. And sometimes then we'll say, well, I know I'm a bit perfectionistic. Sometimes I know I don't have a lot of boundaries. That's entirely different than relabeling the fact that I don't have enough compassion for myself. It shows itself as perfectionism. It shows itself as lack of boundaries. It shows itself of making poor choices. But until they're willing to relabel that, to change their own story and say, okay, I am not being compassionate to myself. Most comment earlier about, would I keep myself as a friend if I kept talking to myself this way? I think all that's really relevant. But for typically people in healthcare, if I go at them head on and say, are you being self-compassionate? Or I take it to the next step and say, I don't think you are being compassionate enough for yourself, I always get pushed back. And so if I can create some curiosity, what we're looking at on the screen now is one tool for doing that, but just the other one we just looked at, the tools are almost irrelevant. But if you can find something that will cause someone to be curious about their own behavior to help them relabel it, that's really the whole point. And then this one, for example, I think I must be all things to all people. Everything is important. I always get pushed back on, well, everything I do is important. Now, what is most important is the key. And unless you've decided what is most important, then it's a completely irrelevant conversation to compare important things to each other. There's no way to make progress on that unless you've decided when important things collide, what is most important. And so as a result, you've got a bunch of behaviors. I typically ask, how many of these are true for you most of the time, some of the time? And then Dorothy, go ahead and go to the next slide. And just to point out the contrast, how much would you like this to be true for you? Or how much is this true for you? And typically, especially down at the bottom, where it talks about, do you feel in control? Do you feel like you're really getting the right things done? Do you feel like you have a choice? And then and even underneath that is, are you really experiencing joy in the journey? And that is where suddenly we typically get the most traction. The illustration that follows, I want to just move on past this pretty quickly, but Stephen Covey popularized this common notion of you have to put in the big rocks first. And you can go ahead and let's just slide through these slides. If you put in the big rocks first, then there's room for the smaller rocks, then there's room for sand, and there's room for water. And then there's a sense of peace of mind that comes when you believe you know you didn't get everything done. But when you start to go to sleep at night, you say, I got the most important things done. If you can say that to yourself, then there's a whole different trajectory in terms of its implication on feeling a sense of well-being at the end of the day. Elizabeth, do you want to add a quick comment in there? Oh, you're on mute, please.
Sorry, lowered my hand instead of coming off mute. If you need to move on, it's okay. But I just wondered, when you were describing the testing and how just getting people curious is the start. And I think I see that in a lot of the people that I work with, and even in myself, is just that curiosity around your own behaviors is super important. But I just wonder, do you experienced coaches ever find that even when people are curious, they may not always be able to identify which of those things really bring value to their life, even with these tests, even with the curiosity? And if so, how do you kind of help them get unstuck? Again, if we don't have time to talk about it, I don't want to derail the whole conversation.
Well, that's sensitive of you. Thank you. I'll just add a quick response, and then we can see if others want to add in. But the idea that if I can get individuals to do two things to step away from the moment. One is to imagine 10 years from now or 5 years from now, what do you want to be true as you look back? What kind of legacy do you want? And is that what you're building? And the other is ask the people around you that care for you the most. Because there are other people that are watching. And if you find some people that you can get some honest feedback from, that's the most helpful. And I see, Chris, you've got a thought on that in the slide. Yeah, correlation between expectations of others and expectations of ourselves. There's all kinds of implications on that in leadership, because everyone will measure their own behavior against yours as a leader. And if you're not demonstrating self-compassion, you cannot expect the people on your team to, no matter how much they want to, because this is the job. And so this would be a good ongoing dialogue to talk about how to break around that. But I do think at this particular point, Dirk's got some excellent research and experience around the idea of appreciation, which is also something that I think is central to this. So I'm going to go ahead and defer to you, Dirk, so we have time to do that and still get to our practice. And you're still muted.
Can I add one
Yes,
thing?
here we go.
Sure, Mo, go ahead.
I was just with what Elizabeth was asking. If there's one thing I would spend as much time with my client on, is the discovery of what's their life purpose.
Mhm.
Because it's the anchor to everything, and it's the cause of a lot of things.
Yes.
It's what gives people meaning, and it gives people, whether they're overwhelmed or not, whether they have satisfaction, lack of compassion, all those things. Is because the more I drill, the more I realize like there's something missing. Of it can't anchor anything to something. And then Wes, what he mentioned earlier is like, okay, he tried to at least get them to a timeline of 10 years from now. I tried to just give them 1 year from now. Just write a letter to yourself of what would make you be proud of that you have accomplished or done or been, or and anchor them even on the year. Like, tell me what, because I can't help you prioritize if I don't know what we're anchoring against. And so that's kind of like the heart of, like, as we drill deeper for a client, it's, you find a lot of people just don't have it, and they're just floating around, and then everything goes, and there's no destination, then all road leads to nowhere. And so then we become disoriented and burned out and all those things because there's no anchor.
Mhm.
Excellent. Thank you.
Wes, do you suggest we skip the responding to requests, or
Let's, that's,
go through it quickly, or?
yeah. Why don't you just walk through those slides real quickly, if you don't mind, and that'd be
Yeah,
great.
absolutely. So just in line with what Mo just described of having an anchor that helps you make intentional decisions about what to say yes to, is also identifying which ones to decline if they do not fit into that purpose. And if you have control over it, then you have an opportunity to decline this. But there are other options to respond beyond the yes and no. One is a counter and saying, yes, if you kind of get the pre-work done, I will help with the next step. Or if I can get your help or 2 other people who can work with me on that, I can engage. Or to delay, really checking first how this request fits with your anchor, with your purpose, with your priorities at that time, and your available resources, to only commit then later. That was that. We are switching perspectives, and we have gotten into that conversation already quite a bit, is coaching leaders to foster well-being in teams and organizations. And Wes left on a point of saying, if the leader is not self-compassionate, then how are we supposed to encourage people working for them to have self-compassion? So we are now obviously in this 3rd section talking about leadership as influencing the culture of wellness, and not focusing on the personal wellness. And one of the things that really stood out to me in this physician wellness survey was that the level of self-compassion basically becomes the ceiling for everyone around them. A direct report will only show as much self-compassion to oneself in the face of a mistake or the need to take a vacation or not respond to an email at night if their leader role models that. So that's really the point we wanted to make here with this study, that a high level of self-compassion allows others around them to do the same. A low level of self-compassion really is the demarcation line and the ceiling to what seems acceptable in that environment. So the narrative in medicine around self-care is really quite poor. And I heard one of you earlier saying, the whole sleep thing, the being proud of not needing much sleep, or I can sleep later when this phase of my life is over, is really quite harmful. These are things that I have heard more than once, many times. These are even things I have thought myself, and I'm not proud to say. They are also things that I have said out loud. So comparing to my patients, I'm doing really well. So what right do I have to take a break or eat my lunch or get 8 hours of sleep? That is just not helpful. Appreciation is one of those recent discoveries in having an impact on burnout or well-being. Again, in the narrative of medicine, it's really hard to find someone who says, yeah, I need that pat on the shoulder. I need that verbal praise or this or that to feel valued. And we often get value or appreciation wrong. So this is a term Muffin Rage coined in the midst of the COVID pandemic, when the LA Times in December of 21 published an op-ed in which this term was coined as the emotion we feel when there's a vast chasm between our actual needs and what another person or an institution thinks we need. So the frequent pastry and baked goods that were brought in when what was really needed were PPE, staff, equipment, etc. The same is what nurses experience when they get pizza parties instead of proper payment or more adequate staffing. So appreciation can really be a tricky thing. And in a study I did a few years ago with the physicians and APPs in my organization, looked at was feeling valued or appreciated related to burnout. And in a regression analysis, we actually found that it is a key driver of burnout. Feeling valued, feeling appreciated is a key driver of a level of burnout. It's a key driver of intent to stay with the organization or look somewhere else. But then figuring out what makes people actually feel valued was a much different story. We know a little bit about that within relationships with the 5 love languages, this famous book that I'm sure most of you are familiar with. A sequel to that was the 5 languages of appreciation at work, which started to give some good insights, but it's very generic and did not give many clues to what could appreciation look like for people working in healthcare. Studies are starting to come out that show that patient gratitude, or having a structured way of communicating patient gratitude to providers, is an impactful way to create the sense of being appreciated and valued. So is creating community building programs and other things. So a colleague of mine and we really put our heads together and took 300+ hours of talking with providers about what it is that they need, want, feel that's lacking, etc., and put together a list of 28 methods of appreciation to get a sense for what will actually have an impact on the feeling of appreciation or being valued. We ran this by a little bit more than 30 providers to see, did we get this right? Does it make sense? So a quick face validity check. And then we ran this in our next annual well-being survey. And you've gotten that article as well as the assessment. So I don't want to go into any of the details here, other than saying there were so many different ways of showing appreciation, and they varied from, it can come from colleagues, it can come from patients, it can come from the boss or the organization. And here are the top 7 that were identified as most impactful methods of appreciation. And it's really interesting to see how diverse this list even is. There are things that we can control, there are things we can't control as colleagues, as bosses, as leaders, as coaches. But the point here is to make clear that what's most important is for leaders to figure out what's true for my people, what makes my people tick, what gives my people the sense that I really appreciate what they're doing. What's also interesting is that not a single one of the 28 methods of appreciation was highly impactful for everyone. At the same token, which would have been great, because then we could have said, hey, do X and you're good to go. Not the case. Unfortunately, it's a little bit more complicated. The good news is also that not a single one of these 28 methods was meaningless to anyone or to everyone. So it's a little bit of, there's definitely good in doing many different things, because it will hopefully meet the needs of many people. But it is even more important to find out what is relevant to my folks. And I'm closing with this slide, pointing out again the boundaries of coaching, and having additional resources available at your fingertips before you need it, basically. And with that, I want to open the floor for more comments, questions, thoughts you have. I want to make sure we have plenty of time for the demonstration and the practice of scenarios. Any comments?
This is related to some of the conversation we had just a little while ago about needing to get input from your family members. But when I was looking, or those closest to you, when I was looking at those questions on how you receive feedback, I was really flummoxed at how poor my own insight was into those. I was really struggling, I think partially because I'm less motivated by those external sort of things than I think a lot of people. And I really had to go to my wife to be like, help me think about these, because I just really couldn't decide if any of them worked really or had an impact on me. So yeah, that was interesting for me.
That's the experience we have made with many people, that when you bring up that question, most everyone will say, oh, I'm fine, I don't need external. If you want to give me anything, give me more money or more time. And that's a, socially and societally accepted way of kind of quantifying appreciation. But what we then learned that feedback and gratitude from patients about the care they received ranked really, really high in reconnecting providers back to, this is why I went into medicine. This gives me, this confirms my purpose. This gives me joy.
Got a personal theory that burned out physicians stop hearing the positive from patients. I don't know if I picked this up somewhere, so don't hear me saying I designed this idea, because I might have gotten it from somebody else. In well-performing organizations, it's that 5-to-1 or 7-to-1 positive to negative. and I have felt like maybe physicians stop hearing the positives from their patients as being part of that milieu of 5-1. And so, of course, then they don't get a ton of positive affirmation from their organization. And so they feel like they're out of balance. Whereas those physicians who enjoy their job, are really engaged in the work, hear the positive affirmations. And so their bucket of positive is fuller than those that are experiencing burnout. And I don't know if it's causation or correlation there, but yeah.
You know, there are studies that suggest that there is some causation in all the research around why does gratitude exercises work for burnout, for depression, even almost as well as some medication does, is because the evolutionary advantage to our brain development of recognizing danger, way more so than beauty or joy, is in overdrive when we are stressed. So the impact on memory, the impact on clear thinking and decision making, the impact on looking for that less obvious sign or element of something good happening is greatly impaired under stress and in burned out physicians. So there is actually pretty good evidence for that. Frank, you have your hand up.
I do, yes, and I'm hoping Amanda might be willing to respond to this question. Sorry to put you on the spot if that's uncomfortable, Amanda. Feel free to say no. But Amanda, I know you've done some cool work with the Elevate program at St. Luke's on feedback and giving positive feedback. Do you have any insights from talking and teaching that skill to people at St. Luke's that would inform that? I'd just be interested in hearing what learnings you might have from that process.
Yeah, so Dr. Kern was part of this too, but I think one of my big takeaways from the past 3 sessions was that we're just not doing enough of it. And that, you know, when we ask the participants in Elevate, like what's one thing you want to do differently after that session, it's really about, I'm recognizing that I'm not giving enough appreciative feedback to my teams, to my colleagues. So that was a big takeaway for me. Not sure if that answers your question or what you were looking for, but yeah, it just really stood out to me this past month.
No, that's perfect. I wasn't looking for anything specific other than what insights you had. That's great. Thank you.
Hey, Josh, one of the things that I will point out also to the work of Boyowitz on positive emotional attractors, negative emotional attractors. And then that's where some of the work also of when we're in a negative emotional attractors, we start filtering a lot of things. And it becomes it's a protectionism. You're trying to survive, that you don't take cue of anything else because you're just so focused. And that's actually what happens to our patients, right? That's kind of where we also remind people is that when your patients are in a negative emotional attractors state, they're not listening to anything else. And so you gotta work first on moving them into a positive emotional state so that you can really deliver the service, so that when they get HCAP, it kind of connects the two, not the other way around. So yeah, you're right in what you were saying earlier about there's something about all the chemicals that gets into that and all our protection that moves us into that situation. In the coaching round, that's where we as coaches have to see where is my client is, right? How are they showing up? How am I showing up? Am I opening the conversation into a positive or am I starting into the negative? And how long would I just kind of let that go until I kind of like bring the shock absorber and just kind of like, you know, sustain them there so that I can move them to a positive aspect, right? And so kind of all of this is so relevant is because yes, stress and burnout, but also there's what emotional state that they are and kind of how you just kind of keep diving into trying to figure out where are they and how do I really start getting more into those feeling side of things versus just the brain side of things.
Good comment in the chat room. Try to heal a patient who doesn't want to heal. You will see the importance of the positive connectors. All right. So I think this may be then a good time to jump into the demonstration, the coaching demonstration. Or are there any questions that we should address first, or comments that we need to hear from the participants, from you all? Wes, do you want to take over and facilitate the demo and then the breaking out into practice sessions? Margie will help us with grouping people together. And since we have a few less master coaches on this call with Pauline and Lori gone, we will structure that a little bit differently.
Absolutely. Thank you. I appreciate all your insights into this, Dorothy. Mo and Dan came prepared to do a little demo for us on this topic. And I don't know if the two of you have decided who's going to go first. Do you want to give a little explanation one way or another on that, Dan or Mo? And then we'll just let you do that. And there's some scenarios up on the screen.
Sure.
Go for
So,
it.
yeah. In the first scenario, I will play the role of coach, and Mo is going to be my burned out client with common challenges. It's all the system's fault. Some unrealistic expectations, perhaps, some unhealthy beliefs, and some low self-compassion. This is really focused on this individual and where they're at. And then in scenario number 2, we're going to flip it. I'll play the role of the client, and Mo will be the coach. And this is a situation that we run into time and again, where you're in charge of a team that is showing very high levels of burnout. And I'll be playing that physician leader with a real team in mind that we have worked with in the past. So it'll be a team of hospitalists.
Very good. Since you two have prepared for this, do you think an 8-minute play on that would be sufficient to start it, then a brief debrief, and then go to the second one? Or
Yeah.
would you
Yeah. What do you think? What do you think, Mo?
Whatever you say, I will go along. I'm just
Let's take a shot,
already
Dave.
burned out, so just 5 minutes, it's just good enough.
So
Yeah.
I'll set my timer for 8 minutes, and I'll give you a cue when the time's up.
Yeah, absolutely. Okay. So here we go. Mo, good to see you again. I always appreciate our time together. What are you bringing to our session today?
I don't know where to start. I mean, it just I'm dragging myself into work these days. I don't feel inspired or motivated.
All right. Let's start with something that's going well. I know this is going to feel a little bit odd for you considering where you're at. What's one thing in the workplace that you consider a victory or something that's gone well? Just one thing.
I showed up to work.
Okay. All right. Sometimes that's the biggest victory, right?
Yep. Yep.
All right. All right. So what do you want to achieve today?
I don't know. I mean, it's just no matter what I do, it feels like I'm pedaling so hard and just ongoing treadmill, and I don't feel people appreciate that, I'm working and taking care of patients and the team and everything, and it is what it is. I don't know.
I heard the word appreciation in there. or a lack thereof. Tell me more about that.
Well, I mean, it's just I I am here first thing in the morning. I am late going home. I pitch in at everything, and wherever we need extra call time or whenever we need time for anything, I volunteer, but it just doesn't feel like people notice or even say thank you.
Got it. So you're feeling underappreciated.
Yes, sir.
What's the biggest concern you have about all this right now?
I don't know if I have the energy to keep going.
Okay. All right. So maybe that's what we spend our time exploring today, because it sounds like the energy piece is going to be pretty big for you. This is the most down I've heard you of all of our interactions, and that concerns me.
Yeah, I mean, I don't know if I have it in me anymore. I just get in, do my stuff, and I feel like it's not fun anymore. There's no joy in anything at all. It's just you slug in, you do it, you just leave. And
Yeah. And we've talked about this in the past. You have experienced some joy in your work. You used to feel a lot more engaged, a lot more vibrant, I guess is the word I would use.
yeah, yeah.
What do you think's going on?
I think just the work has gone more and we don't have enough resources and we don't have enough staff that it's just, some of us who are just willing to roll up their sleeves ends up with the burden of everything else. And nobody is investing in hiring more staff and hiring more. And so we're doing what we can.
All right. All right. So are you willing to unpack this with me a little bit?
Whatever you say, Dan.
Yeah, and the reason I say it that way is because what I want to do is I want to do a little work around the pieces that you can control and the pieces that you can influence, because I'm hearing a little bit of both. I'm hearing that the system has got some things that they're doing. I'm hearing about this. And yet at the same time, as I was listening over the past couple of minutes, I counted on 7 different occasions in just that short conversation where you talked about volunteering, about you putting in the extra time, about you being the one that was doing these extra things.
Mm-hmm.
And so it really sounded like when it came to setting boundaries and limits, there wasn't a lot going on there for yourself. Is that accurate, or do I have that wrong?
No, you have it right. I mean, if I don't do it, who's going to do it?
Yeah. And yet, if you keep doing it, what's likely to happen?
I'll drop and burn out completely.
Yeah, exactly. And I certainly don't want that for you. And I'm guessing you and your family and anyone else who cares about you doesn't want that for you either.
No.
All right. So let's do a little work around this. One of the things that I want to do is I want to take you back to some of the work experiences in which you found yourself in your sweet spot.
Mm-hmm.
So let's go back to that space for just a little bit, because I think it's important to reconnect to that and then go forward from there. So can you think of an experience where you found yourself in that sweet spot, where you were feeling connected, you were feeling effective, effortlessly absorbed, we might say, inspired and fulfilled?
Yeah, I mean, last year we had the right amount of staff. We had the right focus, and it feels like we were running on all cylinder. And so you could enjoy, I was enjoying coming to work because there were other people to do the work. Now I'm like, you look around and we don't have enough people. So I ended up doing a lot of the work.
Okay. It sounds like you still worked pretty hard back then.
Yeah.
Okay. What was it that energized you at that time, even though you were working so hard?
Seeing the result of the work, seeing the family and the patients being happy at the work there, you can see that they appreciate our work. That's kind of what kept us going.
Okay. And what were you personally drawing on from within yourself?
That I want to be of service to others and I want to help.
Okay. All right. And so taking that forward, what's changed for you?
I just don't have time. I feel I'm doing a lot and I don't have time for everything else.
Okay. All right. Where do you think that slippery slope started? Because you've shifted into a different space.
Well, it's when I was asked to lead this team and I said yes. And then I feel like I don't have the resources to be able to do it all.
Okay.
All right, 8 minutes is up. I hate to interrupt because you're going in some good directions. Real quickly, before I involve comments from the other group, where would you like to go from here, Dan?
Yeah. Couple of things is that what I'd like to do is, first, you saw me setting a foundation around the things that he can impact, and then going back to that, it's like let's rewind it to a space where he was in a good place. All right. And that's going to do two things. One, that's going to let me know if he can even rewind to that. Because as we talk about where our boundaries are and where our limits are as coaches, if you've got somebody who can't even remember when they were in a good space, you may be at that line where this could be a situation that could result in a positive referral to another professional. All right. So I'm checking on that. Okay. Good news. He was able to rewind. He was able to remember exactly what energized him. So from there, I'm going to look to build a ritual. I'm going to see what ritual of boundary setting, what ritual of remembering, what ritual of connecting with that positive space he can build within himself, right? And this is, you remember you're reading the Harvard Business Review article. This is really where that comes. This is taking what you read in that article and sort of bringing it to life. Because if he can connect to one thing, and I think for Mo in this particular case, obviously the leadership role was something that it caused him to cross over the boundary. That's where he drove into the gravel. It added just too much. And so how do we bring some of that back? How do we revitalize, re-energize, and get him into a space where he feels a greater sense of well-being to be able to square his shoulders and set some boundaries that he's not setting right now?
Oh, nice, nice. So Mo, from the other side, anything that you would like to have heard Dan ask, or anything that you would say this was going real well, keep going that direction?
Yeah, well, I think Dan was masterfully trying to kind of reset the emotion and the state, right? And so I was in the negative mode. He was trying to kind of like, okay, well, let's talk about where's the positive side. So he was like on the U shape, just kind of like, oh, okay, well, yeah, there's this. And then, well, tell me about this. Tell me when you were seeing joy. Okay, well, what changed? All right, so he was just going there. So well done there. I wouldn't have done anything different with what Dan was doing. I mean, if he has more time, he'd probably dig into it further. So
Yeah. One of the things that I want to emphasize is that it's so tempting, you know, as coaches to go right into that dark space where they want to, and this is where cortisol is generated. All right. And I mean, if you want a real challenge, go ahead and be a part of the cortisol generation and then try to work yourself out of it as a coaching pair. I don't recommend it. Getting some positive chemicals going, and you'll notice I acknowledge that this is going to feel a little strange. All right, I'm going to go someplace that maybe is going to feel a little odd, because I don't want him to think that this is just a rose-colored glasses coaching moment, that I'm very intentionally taking into a positive space. And I'm doing that because I want to shift the neurochemistry. I don't want the cortisol thing to be reinforced by what I'm doing. So his brain sits up and takes notice. Chemical shifts a little bit. It's like, oh, some positive chemicals. Well, this is refreshing. and then we see where we can go.
I like the way that you activated his curiosity about something positive in the past, when in that particular moment, I didn't think he had the energy for curiosity. And that's a tough place to be. Dorte, you look like you wanted to share something. Any observations that you'd make on that?
No, I'm just delighted. I think this was a really great way of demonstrating to not being sucked into that super low energy, the very dreary kind of emotion of the client.
Yeah.
And what I think is important to see is that Dan went there fairly quickly with very direct questions. There was not much preparation or commenting or reframing going on. There was like, okay, this is where we're at, let's go here. So he took a pretty directive approach, which I think with a client that is so low energy, who brings so very little in terms of offering thoughts to the table, that's okay, or that's more than okay. That's probably what makes a coaching session work at that point.
Yeah, really great. Anyone else want to ask a question or make a comment before we move on? Frank?
Yeah, thanks. First a comment, then a question. Comment, I was imagining this granite face that Dan was looking for little tiny footholds or toe finger holds that he could find, and having to search all around there to find that little nugget that you could grab onto to start the conversation. That was really cool. The question, I mean, as I was listening to this, in my mind, I was saying, oh my gosh, Mo he sounds depressed. Are you going to do depression screening and do that referral and go down that route? And you very intentionally did not do that. Explore that a little bit. I'm curious how you decided not to do that in this situation, and in which circumstances you might have chosen something different.
Dan, your thoughts?
So I thought that was a question to Mo. Sorry, say it again, Frank, because I was waiting for Mo to answer. Like,
no, Dan, sorry, you chose not to do depression screening. Why did you make that decision, and what might have prompted you to make a different decision?
Yeah, and it was the test of the his ability to reconnect and stay in a positive space. When he was willing to go there, and I sensed the shift in his you heard a tone shift, right? It's a tone shift to a positive. His energy, his body language, it was very, very subtle, but it said to me, okay, the patient is responding. All right. So he's not we're not dealing with an unresponsive patient. Had his response put up a bunch of red flags, my entire plan and line of questioning would have been set aside, and compassion and advocacy would have been the two skills that I would have brought forward. And just that. Here's what
I feel the exact same way I saw those shifts. I would have made the same choice. And I think the one question was enough of a check into depression, as was, and maybe I'm giving that too much credit, but the initial observation of his voice and the slightly whiny tone is not as scary for me as when clients come and they're 100% flat affected. That scares me way more. So there was a little bit this complaining, oh, poor me, and you know, it all sucks, I'm so sad, kind of thing that I mean, I'm being flippant about it, Mo, sorry, but that didn't frighten me as much as really clinically depressed clients show up.
Could one of you share what that transition would sound like, just briefly, like how you'd lead into putting everything aside and shifting to that compassion and concern and getting additional help?
Yeah, Dorte, you want to take that?
Yeah, I would first share my observation of tone, of energy, of emotion that I pick up on, or vibes that I pick up on, and ask if it's okay if I go down there and just check for other issues. And then I go down and say, you know, how's sleeping, how's eating, how all those types of things, to get a sense for where is this person physically. And you know, if you know, I ask about what about substance misuse, drinking, smoking, all of that. I just go there, and it's really uncomfortable. But the ones who really consider the question, it's like, let me think, you know, that's my answer. The ones who kind of snap out of it, it's like, oh my God, they recognize what I'm doing. And I'm like, no, I'm not there. I have asked people if they're thinking about hurting themselves for that very same reason. I've gone through training as a suicide prevention, whatever person. And one of the key learnings I took away from that is, if you do find yourself with that knot in your stomach and that thought pops up, that is this a person at risk, do ask. Don't beat around the bush. Go there with a straight question. Because, you know, worst case scenario, you are totally wrong and it's really embarrassing. I can absolutely survive that and live with that for the rest of my life just fine. Not asking and something happens, not so much. And that gives me a chance to then talk about, well, I'm so glad to hear that. And, you know, I just had this feeling because here's what I was picking up. How do you feel about it? And then engaging from there.
Yeah, well said. Let's flip this scenario and let Mo and Dan swap roles, and we'll do that for another 8 minutes. You want to set that up for us, Mo?
Sure. Which one do we want to do, Dan?
I'll be the director of the you remember the FIT team?
Uh-huh.
Yeah. Burnout team. So I'm leading a team of medical directors from various sites, and they've been engaged with CTI, HLI, and they burn out.
Okay, very good. I'll set the
All
timer.
right.
Go for it. Try 8 minutes again.
All right. Hey, Dan, great to see you today. How are you?
Oh, yeah, I'm doing great, Mo. I've probably a little short on time today because I've got to meet with the team. They've called a meeting because they want to talk about some of the things we've got going on system wide, and yeah, and they're not happy. So anyway, but I'm glad to be here.
And so we'll maximize our time so that you're getting ready for that meeting. how can I help you get ready for that meeting? What's on your mind as you get ready for this meeting?
Yeah. Thanks, Mo. I really appreciate it. And I was looking forward to our call today because I'm not sure where to go from here. They were really engaged when we did the line of sight piece.
Mhm.
And each had their own particular site. They had goals. They struggled a little bit talking with their people, but I think they got through it. But now they're just angry. The system is just pressing hard. They turned down our request for more APCs. We thought we had a really good plan.
Mhm.
And so now it feels like we were getting somewhere good, and we've slipped back a bit. And so this meeting, I think they just want to yell at me a lot.
Well, get your armor on.
Yeah, I've got it.
Yeah.
I've got it. I just have to figure out exactly what that means.
Yeah. So would you like to spend our time just kind of getting ready for this meeting?
Yeah, that would be.
Hours to you. Okay. So let's skip forward to the end of the meeting.
Okay.
Okay. And what would you like to be the positive outcome of that meeting? What would you see happening or people saying or doing positively as an outcome?
Yeah, I think what would be great is if they came away with a sense of hope. And I don't know how to give them that, but that would be my hope. Is that here I go with that word again. I think that if they walked away feeling like they've been listened to, and they had a real sense that something was going to break loose in a positive way, something was going to change. I feel like these guys just need to catch a break. I mean, collectively as a group, they've been putting their heart and soul into all of this. And they just are looking for a return on that investment. You know what I mean?
Yep. So what I hear is that if you and I are standing at the door, we see people at least leaving the room with some sense of hope and empowerment, or feeling a little bit of positive momentum.
Yeah. And it doesn't sound like that would be that hard, but I think at this point with this group, it is.
Okay.
Even some of our frequent flyers from the standpoint of positivity, the ones who are always saying, hey, it'll get better, etc. Even they've kind of gone quiet, and that's what really concerns me. They're my canaries in the coal mine.
Where do you stand on that? Do you believe that there's hope?
Yeah, I have to.
Well, that's not my question. That's not my question. My question is, do you believe? Not do you have to. Just, do you believe deep in your heart that there's hope and there's a way for us?
I was hoping you wouldn't ask that.
Why?
Well, because honestly, Mo, I'm starting to doubt that. The last 3 times we've gone to the CMO and put a plan forward, it's gotten hacked to pieces, and I've had to come back empty-handed. And I want to be a believer. And I'm really, really, to be honest with you, I'm starting to question.
Yeah. Well, if you are in that mode, right? What do you think your team is gonna feel like if you are in that mode?
Yeah. And this is what I'm losing a little bit of sleep on, is if I can't believe, how are they going to? I mean, I put on the brave face and I was ready to go into this meeting. I'm ready to go into this meeting and do it again. put on the brave face and try to generate some positivity and try to focus on, what we can control. It feels like I'm getting backed into a corner.
Okay. So let's just use that for the conversation, right?
Okay.
So what is some positivity things that already have occurred, right? Yes, we bumped our head against the wall multiple times, but we did make progress against all odds. What are those?
Yeah. Well, and you guys helped us to generate this, because when we did the line of sight, and when every different site did their LOS, it was well received. And they are making some progress on their goals, even though their physicians were pretty skeptical to start with. So, and I think this is what keeps them going, frankly, is we've at least got that. The question is how much can I milk that as the reminder that, things are moving in a positive direction? I don't know. I worry that it'll run out.
What do you think will energize your team in the meeting?
I think a win, if I could give them some kind of win.
Okay. What would be a possible win that we do have control over of influence that they could rally around? That doesn't mean it's already done, but there's potential for success.
Yeah. Well, the good news is that some of our census numbers and other things have come up. And although I've been told I'm not at liberty to say anything, we're getting to the point where that no conversation around the APCs is becoming a maybe. And I don't want to give them hope and then have it dashed on the rocks.
Yeah.
It does sound like there may sometime in the next 30 days be some movement there. So I'm in this weird place because I can't say, but there's some hope.
So let's think about another one where they can build even more momentum together beyond that resource issue. Is there other things that they could help each other around, or they can learn from each other, or someone who has already done that?
As you said that, light bulb came on because there is that initiative up north where she said if the pilot worked out well, it could spread to the other sites. I'm just worried their physicians have the energy for it, but it would be.
You never know until you ask, right?
Yeah.
I hate to interrupt this. I'm learning as we go. This excellent dialogue. Both of these have been outstanding. I'll go first to you, Dan. What did Mo do right, or what did you appreciate how he took you down that path?
Yeah, first off, it was a completely real scenario. And I think Mo recognized it because he knows all these players. And this is just a very real world situation. Here's the thing is he hasn't heard this conversation. Right? And so I just laid it out there, and as I just totally absorbed the role, of the inpatient team leader. And if he didn't take me there, I wasn't going to go there. Let's put it that way. And so a testament to the coaching and the use of the model is look where he got me.
Excellent.
And it wasn't that I was scripting. As a matter of fact, I was scripting to be a pain in the butt. From the standpoint of no, I don't know what I can do. I don't know, these guys they're burnout. We can't go anywhere. We just don't, and I'm stuck. Well, the thing is he was too concrete. He didn't allow me to be stuck. In fact, very real world, when he said that last thing where I said the light bulb came on, it actually did, because I was thinking about, there is.
I can tell that was real. Yeah.
Right. I'm thinking, oh man, I need to circle back with these guys because I think that could help.
Well, Mo, let me go back to you. Where would you have liked to have gone next? And it looks like it's apparent, but you may have some other things that you had in mind on that path.
And it was just to continue to for me, it would have been just to continue to make him realize that if he doesn't believe it, then he's not gonna get the team to believe it. And that's kind of where, and so my work shifted to, does he truly believe that there's a way forward? And so all my conversation became on him, not on the issues, it becomes more on him. So that, because people will take the signals of their leaders real quick. And he he kept saying, well, I can fake it, or I can, like, no, it's either you believe it or not believe it. So I was gonna, if it will be there. And then my goal was just to energize him, from the inside out, so that he can go and give them hope. But if he's not hopeful, then we're gonna have to cancel the meeting.
And that may be the right thing to, get your head and your heart right. And if you can't do that, then why go into this and hand yourself a loss? One of the things that was very, and this happens commonly, you'll see this as you take on more clients, is that just that moment of clarity around my own space freed me up to be able to work in that co-creation space with my coach. Right. So that just being able to acknowledge that I've been a loyal soldier, and I didn't want to admit that I was losing faith or had lost faith. And yet it's very freeing to be able to just put that out there, and yet still hang on to your leadership responsibilities, that mantle of responsibility that you wear. You can acknowledge that to your coach, and then it's just extremely liberating. You can see that in your clients. They'll just come to life sometimes once they've gotten that truth out with somebody they can trust.
I love that.
And that's what you saw there, is what I call the healthy empathy. I was willing to be empathetic, but I was not willing to be paralyzed by his self-doubt. Like, I wasn't going to go there with, oh, you poor soul, okay, let's just explore that. And versus, yes, I know, understandable where you are at. And I know you better in the sense of, I'm with him, like, right? I'm with him, but I'm going to use my energy to lift him up and empower him, versus I'm going to go down with him. And that's why I love the use, because it's always a visual reminder, is like, at certain point, these shock absorbers is going to have to bounce us back. It's like, you go down to a point, but then we're going to have to start climbing back up. And that's always like, so that's what was going on in my mind. When he went there, I was like, okay, I'll support you, and we're going to climb back up into that conversation. So
I love it. Real quickly, any other comments that someone makes that you have a question or anything that you want to compliment? That it was really well done.
I thought it was really brilliant and a good demonstration of how quickly things can shift and start to move in the right direction when you have, trust and real knowledge about each other. So one of the things that, initially when I learned how to coach, I thought, oh, I need like 2-hour meetings to get anywhere. And really the opposite is true. Once you put in the work in terms of building the trust and rapport, you can get so fast in going where you need to go, that, session 3, 4, 5, we hardly ever use kind of the full hour, which I thought was impossible. And this brilliant demonstration just showed that.
I agree completely. Yeah. really excellent demonstration of that.
Yeah.
Well, we want to have
Just to confirm,
Sure.
just what. So in my master coach class I'm in, yeah, I'm a student too. We're only allowed 20 minutes coaching.
Yeah. Yep.
There's no an hour cycle.
Yeah.
It's 20-minute max. So after this session, I have 20 minutes conversation with other master coaches. So
that really makes me want to ask Mo, how does that make you feel?
No, look, I mean, this is why, well, you can't see it. I'm using whiteboard these days because it's like, okay, I'm just going to go directly to drawing and like, okay, well, here's framework. Let's just, let's talk about this. All right. And just kind of, and this is where, you can cover your ears about ICF is a process. This is where you can again go from, am I coaching the process or process coaching, or am I advising, and where you're on the dance, right? This is where you gotta balance all those things. Like in 20 minutes, you can't be just into the question they're trying to discover. In 20 minutes, you gotta go questions, suggestions, challenge, different perspective. I mean, you just gonna go boom, boom, boom to be able to. You can't just be on the process side of things, just like, and how does that make you feel? And like, no, it's like, okay, and you saw that with Dan. It's like, okay, Dan, all right.
Yeah, really good point, which is extremely helpful when you're working with physicians, especially who find it really difficult to block that time. And if you offer a 20-minute coaching call, that might be a lot more accessible and have a series of those. Let's jump into the scenarios. Let's see here. I'm going to see if I've got my screen put up here. There we go. We're going to break out. We don't have all of our typical coaches here, but we're going to move into some, let's see here. What do we got here? I've got to get my sharing correct. There we go. No, I know I can do this. I know I've got slides somewhere. Dorta, what about your slides, Dorta? Where's the assignment here on our, I wasn't prepared to show that. We'd like to invite you in pairs to do just what Mo and Dan have done. It's almost the bottom of the hour. We'd like to give you 30 minutes for each of you to try 8 to 10 minutes as the coach and the coachee on these two scenarios, then reverse that, have a little conversation, and then we'll come back at the top of the hour and see how that went. You've just seen demos of these very scenarios. You may want to tweak it from your own experience or go a different direction. But that's really the goal for the next 30 minutes. Does that seem clear enough for you to enjoy practicing at this particular point? We're going to do some random assignments. Some of you may be together without a coach in addition to the two of you. Some of you may be on your own, so you'll have to monitor your time. We'll reconvene back maybe just a few minutes before the top of the hour, and then we'll have a group debrief on that. Hey, Margie.
Yes, can I jump in? Hello, everyone. This is your friendly neighborhood Zoom host hiding in the background. I just wanted to share our plan for today is a little bit different because we have an odd number. We had someone who had to head out a little bit early today. So most of the groups, 3 of you, will have 2 participants and a mentor coach. We have one group that will have 3 participants. Dorta, Wes, let me know if you'd like to do this differently. My thought is, of those 3, talk amongst yourselves and select one person to play that mentor coach role for the other 2. Does that approach sound okay for you all?
I love that. I love that.
Okay, great. All right. And you said 30 minutes, Wes, is that right?
Yeah, total. And Leah, I think you had a question.
Yeah, I was just gonna say, I actually have to head out at 11:45 today to roll into my next thing too. So if I can be in the group of 3, then I wouldn't disrupt anything.
Oh, you are, Leah. How perfect. Yeah. I must have known that. Okay, great. Well, that makes it easy. Okay.
Excellent. Okay, well, let's go have some fun with this and see what we can learn from some practice. So,
all right.
Lots of smiling faces. That's wonderful.
this was exciting. And I really appreciate your leadership today. There's some great information, some really good questions from the group as a whole. In the next few minutes, is there someone that would like to say either a question or an insight that has been triggered? Anything that you'd like to add as we try to wrap this up today?
Well, Frank and I think both got a lot of value out of that last session, partially because Wes dropped a nugget of a kernel of knowledge on us, and I ended up quoting him when I was coaching Frank. But he was drawing this distinction between sort of having direct control over things and influencing things. When you're working with a physician or a physician leader, they might get hung up in what they have control over, and guiding them towards what they actually can influence felt like a very productive idea that Wes introduced. I mean, again, it's not like a fully new idea, but in the context of coaching physicians, that felt super helpful.
Yeah.
What else is on your mind? And what else?
What I thought was also it's when you sense what's happening to someone, right? Because I think we all, especially in healthcare, I think we can commiserate pretty easily with like, oh yeah, I've been stuck in this problem. I can totally see what's going on. It's very hard to not just only feel with that person, but to not to then just let it be not as productive of a session as it could be when you're trying to, I mean, right, you need to hold space, but to then allow that momentum, that downward momentum. I think Mo, you were saying that earlier, right? To also like soften that and gently, be that trampoline for them and bring them a little bit back up. And sort of that trampoline piece was it's hard because like I think we kind of feel it. We go like, oh, I so understand where you're coming from, especially when we know scenarios and we've probably been in similar situations.
Healthy empathy. Just remember, just stay in the healthy empathy and just be empathetic, yet don't get into the ditch with them. Just stay out of it. I remind myself and others, is like, stay out of it. It's like, my job is not to be in the ditch with them. It's just to stay out of it, and so that they can figure out a ladder to come out of that one. But it's so easy because also we all have so many experiences and we've been there. And it's like, so it's like, okay, so just keep it and keep that urge for going into the ditch, keep that urge in control.
And we in this academy, we've had a lot of focus on cultivating self-awareness and how valuable that is and how empowering that is for then leading change in ourselves. I think it's really helpful, even if we have someone that we don't know where they need to go next, they don't know where they need to go next. But if we can say, I really want to compliment your self-awareness in this regard. And what do you think is the next thing you might discover about yourself in regard to this? In a way, it may not be going toward an action yet, but it's a way of helping them understand that value of really knowing where they're at and giving it and allowing themselves to explore that before they feel compelled to try to make a decision. So, other questions, thoughts? On a scale of, no, let's not do the scale. We just have a few more minutes. One thing that you'll take away from today, what would that be? I see, Brianna, you're smiling. You may have just had something pop up on your screen, but I'm going to put you on the spot anyway. Something that you'll walk away with from today.
Oh gosh. For me, as I mentioned in our role play, how much I hate role plays. But what I need to take away is to really embrace to embrace them
Yeah.
a little more.
Yeah, that's an excellent, because role playing with your client, we've not done that. We've not even talked about that, but role playing with your client can be very, very powerful. And if we can get really comfortable with that, we can give that gift to them too. So good.
Great call out. Thank you.
Yeah. Danny, is there anything particular on your mind? A particular insight or takeaway from today that you'll do?
You're on mute.
Sorry, there, I was able to unmute. So, I love the role playing. I did it with Amanda. It was great to watch Amanda coach and then be coached. I'm going to use as much as I can.
Great. Thanks. Who else? Something from today this is something that we practiced, or a question I'm going to pursue some answers to? Anything?
Building off of what the sort of joke Danny and Rihanna made together, which is how different all of us are, and that self-reflection and understanding what your own personal motivators are has power to it. And again, the one questionnaire that I ran into and was like, I have no idea how I even feel about these, I think is a good opportunity for me to be thinking more about how I like or respond to being recognized. And I had a good preliminary conversation with my wife, but more introspection to do on that.
Yeah. And it is also empowering us as we move forward. We do have some control, certainly influence over our situation. And if we can structure those situations to meet those needs that we know that we have because we've identified them, then I think we can influence that. Yeah. Frank, what's on your mind?
Yeah, I'm going to take away the 7 different ways that people get appreciation and try to be mindful of adjusting my style, both for trying to personally be more coach-like in the way that I'm interacting, and then as a coaching tool in my conversations to help provide a little bit more breadth of appreciation for teams that view things differently.
Yeah. And earlier we had the conversation about identifying your values and, your core values and what's most important to you. Interestingly, this idea of appreciation is really central to that, because it's like one window into a room of our motivation. And so sometimes that's an easier conversation than saying what really motivates you, to say, how do you like to be appreciated? What really makes you feel good when people do that? So just one more tool. Who else?
I can chime in.
Great.
I think 2 things. One, like on a professional coach level, is just I'm always astounded by how quickly things can shift for a client, like that you don't need a lot of time. Like I just keep coming back to that. And then 2, I think for me personally, is just my own energy management, and those varied assessments that we took as part of the pre-work were very insightful to me. So I plan to spend a little more time exploring that and just thinking about my own self-care.
Nice.
Nice.
Anyone else want to add to this conversation before we wrap it up?
I thought Michaela and Elizabeth did a great job with role playing. They played it so well that they were into it, that it almost felt real. So so role play sometimes could be fun, just to be for an observer, just kind of watching this whole thing play out. So good job, Elizabeth and Michaela. And then I agree with you, more self-compassion, as Michaela said. It's like more self-compassion.
I'm a believer in that. So I'll just share, from a personal scenario, I've spent a number of years working with people with burnout. I mean, over several decades, actually. And so I've always been attuned to well-being and taking care of myself. But it was not until back during the pandemic when I had an extended period of conversations with my wife that she pointed out that I was doing a really lousy job of that for myself. And so we had to come to some agreements and have her accountability. Just the process of me making some agreements about what I would do in the future has been very motivating for me. And I haven't lived up to all those, but it has impacted my trajectory. I think in this category of well-being, we are so capable of self-deception and justifying what we're doing. And it's always a moving target. What's true in this season, in this year, in this month won't be true next month or next year or in the next season. And so it's constant evaluation, which means I need constant feedback because I'll set this goal and that'll become my benchmark. And then things change and everything gets screwed up. And so it's an ongoing conversation with people who will speak truth to us that know us well enough to do that. And then where we have a sense of accountability to keep that conversation going. I think ultimately well-being is so unique to each of us that it has to be that very dynamic, personalized element. Dirta, this has been a real gift from you to us. Anything that you'd like to say before we sign off?
No, just a very heartfelt thank you for allowing me to facilitate one session, to work a little bit with this material. It's been a joy for me, so thank you so much.
And Margie's hiding behind the label of Zoom user, as we know, but the truth is we owe a great debt to Margie for making all this stuff happen. So Margie, I know you're listening. We value you so highly. Thank you for making that happen. So
thank you, Margie.
Thank you, everybody.
There's no reason for us to go any longer if everybody feels we got a sense of closure here.
All right, there is a session evaluation link to that in the chat box for you.
One last request and we'll be good. Great.
All right.
Bitte schön, Michaela.
Thanks, everyone.
Bye, everybody.
Bye. Bye-bye.
Super. Thank you.